No, I'll come over there. I'm just gonna show him what I did, so he's not super surprised. Sorry.
Yes, yes. Yes, yes.
Thank you.
Hi, how are
Someday
you?
I'm actually gonna donate to I'm actually gonna become a member of the WISC community.
Okey-dokey.
Keep thinking about it, and then I just do stuff like too.
Anybody else has?
But I
communications
pretty
forms,
appreciate
please
doing
turn those in.
Let's see how this goes tonight. Always a new experience.
right, technology, and then everything else.
Yeah, the last board meeting was a new experience, let me tell you.
That was interesting.
Sitting in the back of the room, wondering whether I was safe for a while there.
Right? Exactly. Hoping we didn't have to have a board. I'm gonna try to-
At this time, we'll call the meeting to order. Jan, would you please take the roll?
Chris Freeman,
Here.
Mark Freeman,
Here.
Tanya Lucy. Here. Clint Moses,
Here.
Carl Palmer,
Here.
Amy Little Swanson. Here. Charlie Schneider. Andy Skilling. Here. David Steyer.
Here. Okay, we have a quorum to conduct business.
Board members, if any of you have trouble with your microphones, please just raise your hand and Brian will come give you a hand.
Everybody's working? Okay. Agenda order, approval revision, anybody have anything? Okay, recommendations and accommodations, we have none. Before we get to communications, I just want to make a short statement. At our last board meeting, we had several instances where there was comments or outbursts from the crowd regarding speakers, especially with our health professionals, administration, and students. And I would say tonight that we will strictly enforce that if there are members of the crowd that are doing that, you will be asked to leave. It is unprofessional, it's unrespectful, and I would ask that as a group, we do better. None of us are going to have the same opinions. I don't care who you are. We're all on different sides of the issue, but at least be respectful. So, with that, we have one written communication, and I'll ask Janet at this time if she could read that, please. Before we go into that, I want to make a short statement about the communications. Comments of the people of the school district in the Menomonie area are encouraged and appreciated by the board and the administrators. Education is a partnership with the school, parents, and taxpayers, all being important participants. Members of the public are welcome to provide comments that are due by 4:00 p.m. Communications were received, we did receive one. This written one and several in person. This is a time to air concerns and express your opinion on issues. There should be no negative personal attacks against any individuals, including staff, board members, or administrators. Please indicate if you'd like the board president or a member of the administration to respond to your concerns. So, yeah.
Hi, my name is Danica Freiberg, and this email is in regards to your broad board meeting tomorrow. I'm unable to attend due to work, but would like to submit my comments about the COVID-19 discussion. I know the topic of masks will once again be brought up regarding school learning and want to stress my concern on enforcing them. I have two children, a kindergartner and fourth grader, who will be attending this year. I have attached the latest media release from Dunn County leaders stating that it is only recommended there is currently no mandates nor state of emergencies in effect for Wisconsin at this time, which is why, as a parent, I voted for optional masking. I understand there are still parents and children who want to wear them, which is why it should be a freedom of choice and not forcing parents and children when we do not have any mandates in place. Wearing a mask is always a choice for people, so why is it okay to take the freedom of choice from parents who do not want their children in masks? It is our children, it should be our choice, and we want to do what we want to do for their health and safety. My children have been home for over a year and a half due to the schools forcing them last year. My children are very hesitant to returning to school due to the mask, and I don't want to have to worry about my children's mental health and what is supposed to be a safe place for them. A lot of parents in this community are angry and upset that our voices and opinions are not being heard enough to make a difference. But without these children and the choices of parents putting them into public school, our schools would not be able to run. I'm one of those parents who constantly feel unheard and worried if the school board is going to force a mask on my children, which takes away my freedom and their freedom of choice anyway. So please hear us, unheard parents, and do not take our freedom away or our children. Masks are only an option, masks are always an option, so please do not force the parents who do not want them for their children. Please keep an optional masking. A lot of parents feel the board is being sneaky about their decisions, and I also believe that needs to be addressed that the people in this community feel as though the board does not care about freedom of choice. Thank you for reading my email, and hope you have a good one.
Thank you, Janet. Okay, as I call the individuals to do their comments, I'll remind you when you approach the mic here in front, you have to turn the mic on. Oh, okay, it's on now. Please state your name, your address, and I will give you 3 minutes to speak. So, and we're going to be very abrupt with that. The first speaker is Josie Tillman. I will do the calling on the speakers in the order that I received them as well. Josie?
Hi, my name is Josie Pillman. My address is 235 3rd Avenue East, Knapp, Wisconsin. And I am a voter in the Menomonie School District, a member of the community. And thank you for allowing me to speak. My concern is about the gender support plan. I want to bring before you 2 word pictures again as we lovingly correct pupils involved in one of the sexual deviance or transgressions. We truly want to love these students and their peers out of great love for the human creature, and as an upright educational institution, we do not want to put swimming trunks into their backpacks. We do want to knock on their door, and when it is 2 a.m. and hot fire is pouring from the 2nd story window. At the last meeting, I gave 3 points of action directed to the board regarding what Dr. Zajdowski and Donna Gorski could do to address the issue. I will remind you of those 3 points. 1, completely discard the gender support plan. Replace it with a new plan to truly show compassion to gender-confused students. And Dr. Zajdowski has shown no interest in addressing that plan. Number 2, students must use the bathroom and locker rooms of their biological birth. Wandering into the wrong facility should invoke discipline and counsel. Use clergy if necessary. 3, instruct Dr. Zajdowski to hire teachers and staff of character. Teachers and staff need to be properly vetted, to be people of high moral standards and character who know how to kindly and courageously stand up and speak out against wrong. They should also know how to defend the speech and rights of students who desire to help their peers avoid the pitfalls of an immoral lifestyle. So I respectfully and pointedly am asking the school board members what the Menomonie community can do to see these actions taken in our precious Menomonie schools. Thank you.
Thank you, Josie. Hold your applause, please. And that goes both ways. So, okay, our next speaker will be Alexander Hall.
Hi, me again. All right, I'm Alexandra Hall. I live in the city of Menomonie, and my son goes to high school, sophomore this year. The school board sets policies that govern the operations of our schools. What is as important but often unrecognized, however, is that those policies also serve an additional function. They communicate the district's values to both the students and to the community. And the message sent by this board's recent decision on the COVID safety plan is troubling. The values communicated by that decision were twofold. First, education doesn't matter. You can study hard, graduate at the top of your high school class, go on to a rigorous university, where you also graduate at the top of your class, go on to get a master's or doctorate degree. You then spend years studying hard to learn everything you can about a subject and come together with other similarly knowledgeable experts to create the best possible recommendations for how to keep students safe for in-person learning this fall. And this district will ignore you. They will instead heed the pleadings of a terribly misinformed group of untrained persons and completely disregard the thoughtful, informed, and educated guidance from CDC, DHS, and American Academy of Pediatrics. Education doesn't matter. The second message is that we don't care. Well, not if it inconveniences us. We don't care about the 1 to 2% of children who get so severely ill from COVID that they need to be hospitalized, or the medically vulnerable students in our district who are at high risk, or the medically vulnerable family members of our students who may get infected by students bringing the virus home to them. For many families, a child in school will be by far their biggest exposure risk. We don't care about the 59% of county citizens who are unvaccinated and at higher risk for hospitalization and death, nor for the already burned out medical workers who might well be overwhelmed yet again by a surge of cases as is happening in several states in the South. We also don't care about the patients with cancer, heart disease, and other illness who might not be able to access proper care, for our hospitals are overwhelmed. We're too tired of it all. We just don't care anymore. These messages are damaging. I don't want to live in a society where education doesn't matter and where we don't care about one another. Quite frankly, I don't think you do either. So please do better. Please enact a prudent plan that is likely to succeed in keeping our kids in school and healthy this fall. Thank you.
Hold your applause, please. Thank you. Bruce Turtle.
I'm Bruce W. Trimble, M7901, 410th Street, Menomonie. I understand that the president has voiced some opinions as to what school boards should be doing in an effort to influence your decisions. I believe that your decisions outweigh him. You are in charge of your own district. And I think that's universal throughout the country. The reason I say that, President Biden is thought by a lot of people in our country and leaders of other countries lately to sometimes not be trusted, to say lies, misconceptions, effort to promote his political agenda. This has been expressed by leaders of other countries as well. With that in mind, I would encourage you to follow the science and not the politics. Now, by science, I mean that of the scientists who are not under the influence of the politicians. The scientists who are not under the influence of the politicians, a lot of them, will tell us that masks are more detrimental to students than they are beneficial. And they will say they are far more detrimental to the student than they are beneficial. I hope that when you're making your decisions, that you follow the science and not the politics. And by the politics, I mean the President of the United States, I mean Dr. Fauci, and I mean the CDC, because the one on the CDC, darn well better follow what the President says. And so, follow the science. The science says the masks are detrimental to the kids. Thank you.
Thank you, Bruce. Our next speaker is Chelsea Lovejoy. Please state your name and address.
Good evening, my name is Chelsea Lovejoy. I'm a resident of the city of Menomonie. I'm currently going to kindergarten this year. Thank you all for your time this evening. We're dealing with a mask mandate. I would request that we reconsider that and add masks as a requirement for schools. I understand the preference for choice, and there are a lot of things that I want us to have choice on. But when those choices interfere with the safety and the health of others, that's when somebody else's freedom and choice ends. When you think about things like seat belts on cars, that's your safety, but we have rules and you're fined if you are not putting your seatbelt, but all that impacts is you and the people in your car. When we think about COVID though, that air that you were spreading and sharing with somebody else has the opportunity to harm somebody else. We can do everything to protect ourselves, but we cannot prevent what somebody else is sharing. This is equivalent to smoking. We don't allow smoking in buildings, so we don't share that bad air with each other. So I ask you to consider something like that when we think about that issue of choice. It's not just about that choice for you, but your choice then affects somebody else. I know many of you are business owners. I'm assuming that you have learned something about the topic of game theory, which often shows that we're going to do what's best for us and will help our business and our models of what we want the world to be. But when we look at those models, particularly the tragedy of the commons, we see that when we all need to do our part, we often fail. As a teacher, I often test my students with this. I offer them extra credit opportunities if they will all vote and work together as a team. I almost never pass out free extra credit on that day because they can't work as a team when there's an opportunity for a selfish moment. So as leaders in this community, I'm asking you to recognize that we as individuals are going to make selfish choices. We need you to be there to protect the community as a whole, because on our own, we're not making those choices. Thank you for your time.
Thank you, Chelsea. I'd like to call Abraham Smith.
Thank you. I'd like to thank David Snyder for his comments about last week's meeting. I found the meeting quite disturbing and felt unprofessional and the lack of decorum in that meeting. And I'm not going to rehash what I said last week about the experience of my 5-year-old in a mask optional situation and what that means to our family. I will point out that this afternoon, the Wisconsin DHS released its new numbers for hospitalizations across the state. And northwestern Wisconsin, there's something like 75 ICU beds. 2 of them are currently available as of this afternoon. So if 2 people get in a car wreck, there are no more beds. That's where we are. You've seen the stories out of Florida and other states. We're getting close to that here. So let's be very, very careful. One last remark, I want to sort of address the audience as a whole, everyone behind me. The meeting tonight at 6 o'clock is very important. It's how we come together as citizens of this district to decide and understand how our school operates as a whole. So I'd like to remind everyone here that that meeting, everyone is welcome to observe and see what's going on in this community. But when it comes to votes that happen in that meeting, that voting is intended for adult voting residents of this school district. Is that correct?
Yes, you must be a resident, elector of the school district in order to speak at the annual meeting and vote.
Thank you.
Thank you, Abraham. At this time, I'd like to call on Thomas Pearson. Thomas is our last speaker.
Thank you for the opportunity to speak. My name is Tom Pearson. I live at 803 Bittersweet Lane in Menomonie. I'm a professor in the social science department at UW South and have 3 children in the school district, all of whom are too young to be vaccinated. My 6-year-old daughter, Michaela, has Down syndrome, which puts her in the category of increased risk for severe COVID-19 disease. People with Down syndrome who get COVID-19 are 4 times more likely to be hospitalized and 10 times more likely to die than the general population. and that was prior to the more contagious Delta variant. As you all know, the CDC recommends universal masking in schools to mitigate risk of exposure. A recommendation also made by the American Academy of Pediatrics, Wisconsin DHS, and DPI, Town County health officials, medical advisors to the school district, school nurses, and district leadership. Recent national surveys, actual legitimate surveys, show broad support among parents for masks, with 63% supporting mask requirements in schools. As a student with a disability, we feel great to attend school safely, protected by federal law. Under Section 504 of the Rehabilitation Act of 1973 and Title II of the Americans with Disabilities Act, schools must provide reasonable accommodations to ensure equal access to public education. To deny such accommodations equates to illegal discrimination. With the Delta variant surging and given public health consensus and popular opinion, it's difficult to see how universal masking in school, at least temporarily, could be interpreted as anything but reasonable. I acknowledge that a science-based argument for an optional mask policy exists, even though I believe the argument is flawed. When I contacted the school board to ask for a scientific or medical rationale for declining to follow public health guidelines, do you know how many of the school board members who voted in favor of the optional mask policy replied? None. None, because they don't have a medical or scientific rationale. The temporary mask requirement until community transmission rates drop again to low levels would increase the safety of children with medical vulnerabilities and allow the school district to meet its legal obligations to provide reasonable disability accommodations under federal law, while also increasing the safety of the general student body and benefiting the community. I assume the school board has corporate counsel or a lawyer. I hope that they are ready for federal civil rights litigation, because that's where you are ready.
Hold your applause. Thank you, thanks. Thank you. Okay, that concludes our community communications. I want to thank everyone here for being respectful. And I and the rest of the board really appreciates that, and the community as a whole, so thank you. We'll move on to our community, or our personal consent agenda. Action to approve personal consent agenda. Is there a motion to approve?
So moved.
Anybody else lose internet? Is there a second?
I second.
Carl, who approved Clint?
Yeah.
Clint made a motion, second by Carl. Any discussion? Okay, let's go. Janet? I can tell you right now, Janet, I'm gonna vote yes, and I'm going to go, so. Does anybody else have trouble? Okay, two voice vote for Janet.
Chris Freeman,
Yes.
Art Bowman,
Yes.
Ryan Buski,
Yes.
Clint Moses,
Yes.
Carl Plummer,
Yes.
Amy Riddle Swanson,
Yes.
Charlie Schneider,
Yes.
Amy Skilling,
Yes.
Nancy Simmons, David Steyer,
Yes. Okay, motion is approved 9-0. Our next action agenda item is approve addition to the 2021-2022 staffing plan. We have a motion to approve.
I'll move to approve the staffing plan as presented.
Charlie, is there a second?
I'll second.
Tanya? Joe?
Yeah, as we put it in the board docs, with the enrollment that we have had some students move in that have some special needs. And Tony Kowalski has worked with the building principals. We've looked at the staffing plan, and maybe board members can mute your mics if yours has a mute button, so we don't get that feedback. Thank you. So in order to staff appropriately, we need to add another 1/2 FTE for the school year. So we're asking for your approval of that tonight.
Discussion.
Any discussion? Seeing none, Janet?
Chris Freeman,
Yes.
Mark Tillman,
Yes.
Tanya Duffy,
Yes.
Clint Moses,
Yes.
Carl Palmer,
Yes.
Amy Riddle Swanson,
Yes.
Carly Schneider,
Yes.
Andy Skillings,
Yes.
David Snyder.
Yes. Motion is approved, by unanimous vote 9-0. Okay, move on to the discussion portion of our agenda. Item 4A is the COVID-19 update. And with that, please.
Okay, thank you very much. And much of my update is similar to what we heard in community communication, so I'll try to skip through some of it. You all had a chance to read it. But there is no doubt that the COVID situation locally and across the country is continuing to worsen. In talking with the medical advisors and other healthcare providers in Northwest Wisconsin, it's concerning to see the increased numbers and also the pressure being put on the medical community. You know, our Downey County numbers continue to rise. That's in the handout. Also, a press release was provided by the chairman of the Downey County Board of Supervisors and the chair of the County's Health and Human Services Board, urging county residents to get vaccinated and wear masks. Our vaccination percentages still are well below any kind of standard for some kind of herd immunity. And we still know that children 12 years of age or younger are not able to be vaccinated. A couple lines that I added today, we do have a survey out with our staff, and our staff just returned today. We have 374 total responses, and so far 86.4% have indicated that they're fully vaccinated. So we're very pleased with the high vaccination rate of our staff, and we think that'll help us a lot in terms of being able to staff our buildings this year. I will give you an updated number at the first meeting in September. Also today, the Pfizer vaccine was approved by the FDA, so it's no longer emergency use authorization for people 16 years of age or older. And some schools, mostly in urban school districts, already are mandating vaccines for students and staff. The state of Wisconsin announced today that anyone who gets a COVID vaccine between August 20th and September 6th will be paid $100. So I know that we put that on our social media, and that's something that hopefully people take advantage of. The final point on the overall COVID status is we met with our district benefits consultants last week, and I want the board to know that it cost the district over $100,000 last year in medical expenses related to COVID-19. So the more COVID-19 situations that we have in our school district, there's also dollars that are going to be spent on healthcare instead of other things in our schools. You know that we've been tracking what's happening around the country closely. I've been sharing information with the board over the last couple of weeks, and it is very concerning to see how problematic it has been for schools in the South when open, especially schools that do not have masking mandates. The high number of exclusions, the high number of COVID cases has been very disruptive. A number of schools have had to move to virtual learning, and many days by school students and staff members have been missed due to either isolation or quarantine. Most schools in our area are still beginning school with an optional mask policy and limited or no contact tracing. The contact tracing piece is really up to the county health department. Our health department has made it very clear that the contact tracing will be expected, even if we are not the ones conducting the full investigation. We are being told that we will need to be providing line lists of potential close contacts in classrooms and school activities. There has been some change. Both the Eau Claire and the River Falls school districts have announced mask mandates. Right now, the River Falls school district is going to open under a K-12 mask mandate, and Eau Claire is operating under a K-8 mask mandate. with the potential of extending that to K-12 probably this week. You're already aware of all the recommendations, federal, state, local, administrative, Academy of Pediatrics. Also, beyond the entities, we've been reaching out to medical advisors from Mayo, from Prevea, Marshfield, all sorts of, pretty much anywhere you could get healthcare. People are recommending masks and vaccines. And I do want to just point out again that I was very critical of the CDC and was very critical of the Department of Health Services last year. I felt the close contact definition was not appropriate. I felt it was changed too slowly. I felt it excluded way too many students and staff members that did not need to be excluded. I was very pleased over the summer to see that the close contact definition was changed for schools. And with 3 feet of distancing, good hand hygiene, and the use of masks, it would almost eliminate the need for students to be quarantined for school activities or be in a classroom. And when you look at that and consider that students, the chance of them being quarantined for being in a classroom in our school district would be very, very slim compared to if we have an optional mask policy. I think the number of quarantines would be quite large. To me, it's very clear that beginning the school year with a mask mandate is something that needs to be considered. The Mayo Clinic is expecting a local surge of COVID cases over the next 2 to 3 weeks, and it's projected to last several weeks. My preference would be that we have a mask mandate at least for the month of September, and continue to track cases, continue to track the experience of other school districts, and revisit it, maybe at the end of September. Also, I really think that having a higher vaccination rate with our students could make a big difference as well. Finally, I want to point out that the decision that the school board makes, excuse me, goes beyond the walls of our school. It also goes beyond the households where our students live. I had a call from Chancellor Frank at UW South today. She's been very kind in terms of reaching out support and sharing information. UW South does have a mask mandate, and I'm talking honestly mask mandate, that's an indoor mask mandate. UW South does have an indoor mask mandate, and Chancellor Frank is receiving concerns and questions from faculty members at UW South concerned about what they're going to do if and when their children get quarantined. UW South is not the only local business that would be impacted by large-scale quarantines. I'm sure many of our business owners and workers in our community will have a lot of difficulty with that. So that's kind of the update on where things are at. We did have an open professional development meeting with staff. It went very well. We went through just a little COVID stuff to start with. There'll be more of that this week. But it was just really excited to see our staff back, and we will be well prepared for September 1st.
Me too.
Okay, before we move into more discussion on this, any questions for Dr. Zadowski? One thing, Joe, I'd like you to clarify. I know you talked about it in your report, but could you just discuss the contact tracing aspect and how we did it last year, why we did it, and what the county's expectations are?
It is very confusing, Dave, and what I've learned more about in reading state statute, it really is up to the county health director to determine what they're going to do to try to combat the spread of communicable diseases. And I've read through the statutes, there's also administrative rules, and essentially, legally, we are required to cooperate with the health director in terms of trying to stop communicable diseases from spreading. Casey Gallagher has issued our school district and other school districts in Dunn County a letter. We've had follow-up communications with superintendents, and the way that she's defining that cooperation is that schools are obligated to provide 9 lists. So essentially, if a report of a positive case is provided to us, and that person was in our school at the time when our school was operating, we would be obligated to provide a list of people that person had close contact with. From there, the health department will take the next steps, which last year we assisted in one of those next steps. but it'll be up to the health department to do that. It's confusing because, you read about some other schools, for instance, River Falls, when they announced their mask mandate, the headline said, mask mandate, but no contact tracing, no quarantine. And I'm not exactly sure what the discussions are right now with their health department, but between the legal advisors, the health department officials, and then the school districts, we all need to try to figure this out. And it's going to be different based on each county, the health director, the county board, and then the county's legal counsel. And what I know, most of it is not county.
Okay, any questions or discussion? I guess one of the things that I would like to ask you, Joe, is that you talked a little bit about a temporary mask mandate in the district. What do you see as a temporary, and what would be the thresholds or the reasons for lifting that if it were in place for a month? Short time frame.
What I think we should do, Dave, and what I recommend to the board is to have a 1 month mask mandate, kindergarten through 12th grade. And we've worked a lot this summer to try to come up with thresholds, some very clear check boxes that, that way, you make the decision and it's done. But honestly, I have not been able to come up with a clear description of what a reasonable threshold would be. We look at community transmission, we look at vaccination rates, we look at hospital capacities. I think all those things need to be considered. But I think also what we need to consider is how the mask mandates are impacting education. And my biggest concern, and as a superintendent, we're all about student achievement. And I just don't know how we can say we're for student achievement if we start the school year with a policy when we know that we can predict, probably 1,000 or 1,500 or whatever number of students are going to have to miss that many days of school because of COVID-19. And if wearing a mask almost eliminates that or really shrinks it down from the school's perspective, that's what I've come to my recommendation.
Just to clarify, 1,000 to 1,500, you're talking student days?
Student days, yes, not students, but student days. And that's just a projection. And I don't know, it could be low, it could be high. And frankly, I think COVID is going to come to our community no matter what we do with masks in our school. I'm not convinced that we can really control this virus. But what I do know is that we can do things in our classrooms that are going to make it so that we're following the recommendations, kids are not going to be quarantined, and hopefully COVID won't be spreading as much as it would be.
Questions? Discussion? Tanya?
And you said K through 12, temporary,
Temporary mask, so you're saying then everyone vaccinated and not vaccinated?
Yeah, unfortunately, Tanya, I think it's important to do everyone right now for a couple of reasons. One, the idea of having people identified based on their vaccination status, I think is very problematic. We don't want to have kids wearing a special button or anything like that, or staff members wearing a special button. And with 3,400 students, we're not going to be able to reasonably track all the time who's vaccinated, who's not. So one is the administration of the policy would make it very difficult. And we saw that in our community, as soon as it changed to be if you're fully vaccinated, then the masks were totally gone. And I think that's what happened in our school. The other piece to it is that with what we've learned about the Delta variant, a fully vaccinated person is just as likely to spread COVID-19 than an unvaccinated person if they contract the disease. Now, hopefully, and it appears that fully vaccinated people are less likely to contract the disease, but it's also very possible that a fully vaccinated person could be asymptomatic and they could be spreading it. And with the Delta variant, the viral load, I think it's very possible for a teacher or student to spread COVID-19 and not even knowing that they have it. So that's another reason why I think the universal piece is important.
Did you have a follow-up, Tanya?
Not right now.
Anybody else?
Dave, I've got something.
Good.
Mainly just for clarification for the public, this is not something we can take action on tonight. We would have to have a special meeting. We do not have another school board meeting scheduled until after the start of the school year. So I guess this is just up for discussion, correct? There's nothing we can do at this point, Dr. Joe?
Well, yes and no. You know, the board at the onset of the pandemic did authorize me to make decisions as needed for the school district. But that comes with the caveat that I inform the board and I carry out the board's will. So, my intent is to follow the direction of the board. The board could call a special meeting, before the school year starts. But until that happens, or until I have guidance to, act under my administrative authority, it still is an optional mask policy. Thanks.
Other questions or discussion? Amy?
I guess what I'd like to say is that looking at the numbers today that just came out by a very reliable health professional that posts them every week, there were 99 cases this week alone that were infected with COVID. About 40 or so of those are children from birth to 9 and then 10 to 18. So we may already start our school year with people that are sick or that are bringing it into our schools. That's number one. Number two, I think it's our responsibility to make sure our kids are safe. I don't like to wear a mask, but I do it because I want to help others. And I want to be a part of my community that helps others. I work at UW River Falls. We have a mask mandate there in indoor buildings. We have a jumpstart group that came. 84 kids that showed up yesterday. Every one of them has followed that rule, and not one of them has balked at that idea. They're fine with it. I think if we all work together, it would be great. I love the idea of 1 month and then checking in. But I also don't want to get to the point where we check in and then we say, oh, well, let's change our mind again. I think we need to be very constant of what is happening with COVID in our community. Thank you.
Joe, thank you.
And I appreciate you bringing that up, Amy. And a couple of things, you mentioned our responsibility. One of the bedrock principles of education is that when someone drops off their student at school and puts them on the bus, we do become, in a sense, a parent. Not for everything, but for many things. And, we take that responsibility very seriously. I am concerned that, not following the advice of not just the government agencies, but also the American Academy of Pediatrics and our local doctors, I do wonder if that's what a reasonable parent would do. And I am all for choice. One of the speakers said it. There's a lot of things that I think choice is extremely important. But when it comes to the health and safety of our kids in our school, I do think we need to consider that. Another thing with the timing of keeping masks off, hopefully, and hopefully it will be soon, with the authorization for students K-12 to get the vaccine. And to me, that's a big deal. Our kindergartners or our sixth graders aren't eligible yet to get the vaccine. It's one thing if you're an older student and you're choosing not to, or your parents are choosing not to get the vaccine. But our young kids don't even have that option yet.
Follow up, Amy. What would you see as a threshold if we did do a 1 month policy through against the county as if we're going away with masks?
I would try to leave it up to the health department, but I would say that, we would have to have a downside. I don't think it could be increasing for sure.
Any other discussion, board members? Chris?
Just a question on common emergency board meetings. I know we tried to do it for Monday morning and kind of get a quorum. Would it be outside of the realm of possibility to try and call a special board meeting after the annual meeting, since we obviously have a quorum?
We have to, the question was, do we have a special meeting tonight? We have to have a 24-hour public notice period posted in order to call a special meeting. So we would not be able to do it tonight after the meeting, but it's certainly something that could be done yet this week before the school year starts, just for clarification. Chris?
So then my follow-up question would be, could we just get together and establish some times when we would have a quorum of people here so that we know ahead of time, when we should be calling a special meeting?
A little hard to understand. You said, we did,
Could we have a discussion at the end of, the annual meeting as to our availability, so we can expedite the process of, having a special meeting? The last time the holdup was that on Monday we couldn't find enough people to come here at 7:30. So finding times when our, schedule allots, time would be preferable to do tonight. So I'm asking that we, share notes on our availability tonight to expedite the process, unless that's not able to be done.
My recommendation, if the board would like to have a special meeting, one, to have a board member request it, and two, Janet could send out a survey and find out which dates and times people would be available this week.
okay, Chris? Any other discussion or questions? Okay, and I'm sure we'll have more discussion from the community as we get into our annual meeting on this as well. Just, Amy?
Just to clarify that, she's gonna send out,
A board member would have to request it first.
well, can I request it right now?
I think the policy says request in writing, Amy, so if you just send me, just to follow policy, why don't you just send me a online email?
Okay,
And then Janet can do a Google poll or a doodle poll quick and find the date and time.
okay, thank you.
Thanks, Amy. Okay, that's it on the COVID-19 update. We'll move on to item 4B. Just a reminder to everybody, our annual meeting is scheduled to start at 6 o'clock. We will run this meeting until 5:55. If we're not done, we'll just recess. We'll start the annual meeting at 6 o'clock, carry that through until it's done, adjourn that, and then come back to the board meeting. When the board meeting, when we get to the end of our board meeting agenda, we do have a closed session item that we have to ask everybody to leave for, but that's not until the end of our actual board meeting. So. Okay, item 4B, review district energy plans.
And Dave, I think we're gonna make it, it's a closed session anyway.
Okay. We don't know how much discussion we're gonna have on this.
That's true. The district energy plans, I want to give a huge compliment to Justin Shinneman, our district energy manager. He worked with our building principals, and the board, as you know, approved our new energy policy. So in accordance with that approval, an energy plan has been put together for the district and for each of our buildings. This really is more about meeting the deadline and sharing the plans with the board tonight. I do think the board members should take some time and review the plans. And then we'll invite Justin to come to a board meeting this fall and be able to speak more in depth and answer more in depth questions. If you do have any general questions tonight, I can take a stab at them. But Justin's a lot smarter than me when it comes to all this energy stuff. I can tell you it's making a difference. When we look at our budget numbers, when we look at our energy use, it has been significantly down this summer compared to previous summers. So I think it's been well received. Any questions?
Joe, just a quick one. With the increased ventilation that's probably been going on for 18 months now, I assume in the coldest seasons, right, we're not just circulating the same air around, so we're pulling fresh air in somewhere. Has that made a difference, a negative impact on heat costs and things like that?
It definitely costs us more, Carl, but with all the changes we made with set points and with unoccupied spaces that are not being used, it's actually still been better overall expenses. But yeah, air circulation is something that's prioritized with COVID. An example I can tell you though is we had a faulty part to the HVAC system out at Knapp Elementary. And with Justin on board, he noticed that the cost for energy at Knapp was really higher than it should have been. So he got a hold of technicians, they went out there, they found the faulty spot, or the faulty piece of equipment, changed it out, and it immediately dropped. So even though we have more circulation, these changes we've gone ahead in the long run.
I guess one question I had, Joe, is are they still looking at the possible solar project?
Yeah, Justin would be able to answer that better than I can, but I do know that continuing to move that project forward. I think right now, the tentative idea would be next summer, but there's still a lot of work that needs to be done to plan for that project.
Thank you. Any other questions? Okay, our next item on the agenda is review extracurricular staff contract requests. Questions for the board? Okay, item D, review our next meeting days. September 1st is our first day of school. The 13th will be our regular school board meeting in September, 5:30 p.m. at the ASC office, and September 27th is our second, our special school board meeting. With that, for closed session, Joe, is it easier to move the board to another location? Okay. Very good. Well, we'll take about a 10-minute recess then, and then we'll start the annual meeting here promptly at 6 o'clock. Thank you. If you want to stay in, if the members of the audience would like to stay in here, they're welcome to do so. You don't have to leave.
Hi, how you doing?
Good.
So, can you tell me anything about this shindig at Cappuccino and how it's gonna work, or?
Well, kinda, between 5 and 6, people are encouraged to place orders and get food and eat it. I think that's a little short in time, but I didn't figure that out myself. And then I'll probably need the orders and welcome people. Explain what women's equality is about. And we'll go through the usual minutes and treasury report that have been sent out ahead. Then I consider that.
Yeah, we're not all week. I think they're being all week.
Hey, Karen. Hey, Karen. We need to sit on this. Because it's going
Okay, at this time, I'd like to call the annual meeting to order. The first item of business is the election of the chairperson of the meeting. Is there a motion to elect the chairperson? A nomination to elect the chairperson.
I'll make a nomination.
Kenny,
Yes. I nominate Dave Star.
we have a nomination. Any further nominations? Any further nominations? We have a second. Any further nominations? If not, I'll ask for a motion to close nominations and cast a unanimous ballot for Dave.
Second.
We have a motion and a second to nominate Chris Freeman. Any other nominations? Any other nominations? Any other nominations? Okay, we'll do it, I think we'll do it by show of hands. Or what would you guys prefer, show of hands or ballots? Hands? Okay, show of hands. We'll do Chris first. All those in favor of Chris Freeman to chair the meeting, please raise your hand. Tellers, would you count? The tellers are Sam and Tony. Board members can vote as well, I'm sorry. You should vote for yourself first. Keep your hands up high, please. Yes, an elector must be a resident of the district of Menomonie, the school district of Menomonie. If you're not allowed to vote. Let me know when you're ready, Tonya. Or Sam. Got it? Okay, all those in favor of Dave Steyer, please raise your hand. Okay, hands down. We'll wait for the results.
Who's going to chair the meeting? To start over with Chris Freeman.
Okay, the vote totals are Chris Freeman, 56, Dave Steyer, 78. Thank you. I would like to appoint Charles Schneider as parliamentarian for the meeting. Tellers, as I mentioned, will be Tony Quesky and Sam Hoyt. I would like to ask the assembly what you would like to do for ground rules for the meeting. For board meetings, what we typically do is we'll allow up to 3 minutes for each board member to speak on any topic on each agenda item. And I guess I would ask the assembly what they would like to do. For board meetings, we do 2 times per person for an agenda item. With the number of people here, I guess my recommendation would be to allow each person to speak 1 time, and you can either say 2 minutes or 3 minutes, however you'd like to do it. But I think we should set some ground rules. Margaret?
Okay. We're not debating, when it comes to asking questions about the budget.
Okay, Margaret's question was when it's not a debate, when it's just questions. So typically at the board, what we do is when it comes to questions, we don't have a limit on questions. If you have questions, you're free to ask questions, as long as they are questions. But as far as if you're making a statement on an issue or something to the district, that would be considered a speaking. So I guess I would ask for a motion from the floor to enact, is there a motion from the floor? Dan?
Since this is a open meeting, it's not subject to board rules. I move that discussion is everyone has an opportunity.
You want to say that one more time?
Since this is not a school board meeting and not subject to the rules or policy of the school board, I move that this meeting be open to anyone to speak and not to have any kosher or limit on this.
Okay, we have a motion. Is there a second? Jim? We have a motion and a second. The motion is to not have any time limits or restrictions on speaking. Any discussion? Yes.
I feel like people who are at this meeting, probably are well-informed, and they care enough to show up tonight. And I brazenly propose that we don't have 4 hours of everybody saying things that we already know. That's my personal feeling.
Any other discussion? Okay, we have one more.
A lot of this agrees with the last lady that just spoke. There's a lot of people here, and there's going to be a lot of opinions both ways on this. And we can tie up a lot of time hearing a lot of repeat. I would love to see it be short and sweet, say what you got to say in a few minutes. After that, it's a ramble. So, again, not 3 hours.
Thank you. So we have a motion on the floor, unlimited debate with a second. We'll first vote on that motion. If that passes, that will be the rule. If it fails, then we will look at other options. All those in favor of the motion made by Dan Paulson, seconded by Jim, to have unlimited discussion, please raise your hand. Those opposed? The nays have it. Is there any other motion from the floor as far as how we handle discussion?
I have a motion.
Margaret?
Some items, I have concern that it would take too long. If when it comes to a official copy, perhaps limit the discussion to 1 minute.
A 20-minute limit on discussions, not for individual.
but in terms of the, discussing the, topic, such as masks, that's probably a big item. That's a 20-minute item, limit on certain discussion items.
The only thing I'll say, Mark, okay, so you have a motion to limit discussions to 20 minutes on any item. Is there a second on that motion? Is there a second? Is there a second? Motion dies for lack of a second. I guess what I would recommend is to have a motion from the floor to allow up to 2 minutes of speaking by any individual. You have a motion?
I'll try to present. I would move that we have a 2-minute time limit with a limit of 2 times on the topic for individual.
The motion has been made that we have a you can speak up to 2 times, up to 2 minutes per time on any topic.
I would second that.
We have a second. Any further discussion? Dan?
How is this different from any board meeting that?
The question was, how is this different from any board meeting? I guess I can, from my perspective, this is the annual meeting. We want to give everybody a chance to talk. We have a lot of people here, a lot of potential discussion, and we'd like to keep it succinct and on point. Any further discussion? We have a mic right there, so.
I would like to add that the rules from the previous meeting be maintained where there's not cheering and cheering going on so that we can focus on the speakers and keep this a little bit.
Are you open to that as a friendly amendment? And second as well?
Okay.
Yes, okay. So we have an amendment to that motion to maintain the rules that we had for our first board meeting, that there's no clapping or jeering or noise of any sort after the speaker gets done, and to be respectful, allow people to say their piece. Fair enough? Okay, any further discussion? All up? Dave?
Again, continuing the rules from last time, to state your name and address when you begin speaking.
The amendment or the motion maker, are you in favor of that? Whoever seconded that motion, are you in favor of the friendly amendment?
Yes.
Yes, okay. Jeff was, yes. Okay, so the motion then would be to limit speaking up to 2 times on any topic, up to 2 minutes each time.
We have to vote on the amendment first.
I get a friendly amendment, Margaret. I got approval of the motion maker and the person who seconded the motion. So,
I came here to ask questions about the budget. I asked tried to get answers before the meeting, and did not. Some of these things in the budget are very confusing, and I'm very uncomfortable with being told I can only spend 2 minutes to bring up a question, and 2 minutes for an answer.
2 minutes, 2 times. So you have 4 minutes total.
Okay, I did not come prepared for this. I came prepared to talk about our budget. This is an ad meeting for us, and I can understand certain issues might be hot and people want to repeat and repeat and repeat. But if board members can't answer a simple budget question before the annual meeting, it's not that simple. If board members can't answer a question in a couple of days, how are we supposed to be doing this in 3 minutes?
Any other discussion? Chris?
I'd like to make a friendly amendment that we follow board policy where you can ask as many questions as you need to, but you're allowed only 2 comments. And for this motion, it would be 2 comments at 2 minutes, and that's all you're entitled to for each discussion session. But comments would be, or questions would be unlimited.
We have a thumbs up here. Jeff, would you approve that?
Yeah, that's all
So the
good.
motion maker and the seconder approve that. So we'll go through one more time. We will maintain decorum. We will have 2 minutes to speak 2 times on any topic. We will have the ability to ask as many questions as we'd like. However, one thing I will say about questions is do not turn them into statements. A question is a question, okay? Huh? Okay, any other discussion? Is that fair enough, Margaret? Yes.
You forgot the part about, making sure that you state your address as well, to make sure that you are elected.
Sorry about that. State your name and address before you speak. Thank you. And you can ask as many questions as you'd like, Margaret. That's part of the motion. You'll have up to 4 minutes, okay? Any other discussion? Okay, all those in favor, please raise your hand. Those opposed? The ayes have it. Thank you, everybody. Okay, our next step on the agenda is to recognize current and former board members. So I'm going to start with current board members. I'm myself, I'm Dave Steyer, board president. This is my 9th year on the board. Chris Freeman on the end. Raise your hand.
This is Chris Freeman. Thank God this is my last year on the board. Thanks for coming.
Our next board member, Mark Kilman. Mark's first year on the board. Next, we have Andy Steelings, also first year on the board. Tanya Hughesby, I'm not sure how many years because it was a couple different. Yeah. Charlie Schneider to my left. We have Clint Moses, Carl, and Amy.
13 and a half years.
Oh my goodness. Carl, how many for you?
3.5 months of auditing.
Okay, I will encourage anybody that does wish to speak or have a question to either come up, well, we have the mic going around the room, so. Yep. Okay, next next thing I want to do is recognize former board members. So anybody that has served on the board that is in the audience, please stand and introduce yourself. I know we have a few. Jim, so you start. Sorry.
Jim Swanson, board member, been on board for 6 years.
I'm Miles, so I'll just talk. Penny Burstead, I was on the board for 5 years, and thank you guys for letting me have my service.
Dan Paulson. Okay, thank you. And Penny, at this time, I'd like you and Jim.
What about Margaret?
Margaret, you gotta stand up. No, it's for anybody that's been on the board. Margaret Bryce, on the board for 12 years. Anybody else that we missed?
Wayne Quillen, 3 years.
Wayne Quilling in the back for 3 years. Anybody else? Thanks for catching that. Okay, at this time, I would like applause. Okay, we can do it for that. Okay, at this time, I'd like to ask Jim Swanson and Penny Burstead, please come forward. We want to thank you for your service on the board, and with that, we have a small token of our appreciation for both of you. So thank you. Okay, at this time, I'd like to get on to the business portion. Presentation of minutes from our last annual meeting. They can be found on page 4. We don't have to approve these, so it's presented for everybody to see.
Right. Hi, I'm Ryan. The school board approves the minutes of the meeting, but they are in the booklet for anybody to review.
Okay, next move to the treasurer's report and audit summary. I would like, I propose a motion that the treasurer's report be adopted as presented. It can be found on page 6. First, I guess, is there any questions on that report? Margaret?
Okay, I guess I'm gonna direct this to Joe. I thought we didn't have to approve this, and this is for our information, because we haven't seen this ahead of time. How do we make an informed decision?
If you'd like, Leah Theater, our business director of business services, she could go through it.
Are you sure what is a requirement that we approve this?
We do it every year, Margaret, they approve it, the treasurer's report and audit summary, so. Leah, you wanna go through it, please?
Sure. Okay, the annual treasurer's report, again, can be found on page 6 in the booklet. The summary of transactions for the general fund, the general fund revenues for 2021 were $40,964,903, and expenditures totaled $40,135,260 for a net difference of $829,642. The summary of transactions for the general fund, special project funds, debt service funds, capital project funds, food service, benefit trust funds, and community service fund. It's noted that we have no funds in the packaging fund, but the total revenues for all those funds I've just read off for 2021 totaled $68,850,400.67. Total expenditures, all funds for 2021 totaled $67,154,287.56. The operational cash summary, beginning July 1st of 2020, cash and investments balance totaled $10,269,914.99. The ending June 30th of 2021 totaled $12,236,012.51. Due to other governments is $1,301,075.13. The ending June 30th, 2021 totaled $1,402,327.91. And then taxes receivable totaled at the beginning of July 1st, 2020 was $5,734,488.86. And ending June 30th of 2021 was $5,599,714.77. Moving on to our debt retirement summary. For referendum long-term summary, in 2021, the payments for the referendum long-term notes and bonds totaled $14,746,000 on the principal and $1,799,031.67 on the interest, and $126,750 in refinancing fees. The long-term notes and bonds indebtedness as of June 30th, 2021 totaled $32,775,301, which consisted of $28,224,000 in principal and $4,551,301 in interest. The non-referendum long-term debt summary for 2021, the final principal payment on these bonds was $90,000. The interest payment was $2,385, and the ending balance in the non-referendum debt fund as of June 30th, 2021 was $0, and it is retired at this time. The benefit trust fund summary, the ending balance in the benefit trust fund as of June 30th, 2021 is $6,429,591.90. Earnings on investments in 2021 totaled $114,597.68, and disbursements in 2021 totaled $1,117,228.59. And the American United Life is the trust fund administrator. Levy of school tax, the tax rates are tentative and subject to review later in October, but approval is requested for a tentative tax levy of $13,531,252 for operations, $3,660,360 for debt service, and $300,000 for community services, for a total levy of $17,491,612.
Thank you, Leah. Any questions? And,
Thank you, John. Approving the treasurer's report.
Can everybody hear?
No.
Okay,
The question
I just seconded, we got a mic coming, so we'll just make it a point that if you have a question, we'll give a mic to you so that everybody can hear the question.
My question is, does approving the treasurer's report automatically approve the levy, or is that a separate agenda item?
That's a separate agenda item. Any other questions?
Is it possible to get some more copies of the annual report? They're no longer on the tape. There's, you know.
I know we have one right here for sure. Janet has a bunch as well, so if there's two of you together, if you could share, we do have one up here.
An extra.
The question was if it's online, I don't believe this one is online.
This one's not okay. Here's two more. This year's pack will be online by the end of the week. There's two more up here. This is great to see so much attendance.
Right, you print it off as soon as you get. Okay, hopefully we get enough copies to everyone. The question up front, if wants to be done handing out programs. Okay, Dan has a question coming.
Dan Paulson. On the summary of transactions, the total revenues exceeds the total expenditures, is that correct?
Yes, that is correct.
So, what happened to the difference?
This is for 2021 school year. These numbers are unaudited at this time, but these are actuals for the 2021 school year.
So they carried over this year?
The question was, did they carry over to this year?
Well, these are all funds. So yes, I mean, some would be carry over into Fund 10, some would be carry over into Fund 21, Fund 50, Fund 38, 39, and so on. But these are all the funds combined. So yes, they do carry over.
Any other questions? Okay, Chris, sorry.
I just had a quick question about budget meeting, which in the last report, this is the largest that's done, it looks like. I think in the last report, it was like at 333, we projected it was gonna go down for that year. And this is larger than in years past, and it also doesn't have, I think isn't there like a liaison officer, like salary that was in there too? And I was wondering if you could explain a little bit about the increased, amount of funds that are in, 80 and where they're going and why they're going up.
Well, that's more of a budget question. Could you bring that up when we get to the actual budget?
Would that be better then?
But it'd be better to settle that at the treasurer's report, so.
Sure.
If you could, please.
Can do.
Thank you. Any other questions on the treasurer's report as presented? I'll ask for a motion to approve the treasurer's audit report as presented. We have a motion, is there a second? Second? All those in favor, signify by saying aye. Aye. Those opposed? Motion carries. The motion was made by Mary, seconded by Alan. Amy, I'm sorry. Brian's wife, I'm sorry.
I have a name.
Sorry.
Actually, Amy and Brian's wife.
That's what I said.
No, Brian.
Brian.
Brian's your husband.
Yeah, that's how it goes.
Did you get that, Janet? Okay. Thanks for the clarification. We'll move on to the presentation of the budget. At this time, I'd like to call on our district administrator, Dr. Zadowski, and our director of business services, Leah Theater, to present information on 2021-2022 budget.
Okay, good evening, everyone. Let's see here. This was ready to go. So what am I doing here? Having a little bit of trouble here. So this is moving on the computer now, Brian, but not on the screen.
Unplug it, plug it back into the computer.
Okay, unplug it and plug it back in. Keep that. All right, good. I'm gonna have to move on here so I can't see on the screen, but that's fine. Okay, again, thanks for joining us tonight. And some of this has already been covered. You already met the board members. I appreciate all the board members for their service on the school board this year. And the mission statement for our school district gets read at every single meeting. But it's all about preparing our students to become lifelong learners, caring individuals, and responsible citizens. I am Joel Zadowski, I'm the district administrator. Leah Theater, you already heard from her earlier. She's our director of business services. Her and I will be teaming this presentation. The demographics of our school district have not changed dramatically over the last recent years. Enrollment was down last year due to COVID-19. There's definitely more homeschooling last year than we typically see. But that is the makeup of our school district. We have a number of great facilities. Our community has done a great job keeping our facilities up to date and to provide safe and healthy learning environments for our kids. And then just to talk a little bit about last year, I mean, as you all know, last year was so focused on COVID, but I'm very proud of what our school district did. We were able to keep our schools open all year long. We had one brief closure at the high school to make sure that we were able to keep our buildings with younger students open. But our teachers and staff did a great job with that. We also did provide a virtual learning opportunity, but it came at a big expense. We had to hire a number of new teachers, a number of new staff members in order to have small cohorts to keep the students separated, and we were able to do that. Our technology team did a terrific job. We went from being, just a few years ago, we became a one-to-one school district with devices for all 6th through 12th graders. Well, when COVID hit, all of a sudden we became a one-to-one school district for kindergarten through 12th graders. That was a huge undertaking, and our tech team did a marvelous job. Despite the pandemic, we were still able to offer our students with many opportunities in athletics and activities. Also, we were able to provide free meals throughout the school year, and that happened all summer, and it's going to happen again this year. Our school nutrition director does a terrific job, and she takes advantage when those programs become available. She opts out and gets those services for our students. We did adopt a new energy management policy. We talked about that just a little bit in our previous board meeting. We now have an energy plan for each school, and we're already seeing the benefits of reduced energy expenses. We didn't have as many projects last year. It was very difficult to have projects done, but we do have a capital maintenance plan, which we'll talk about later, and also we were able to do a secure entrance at the middle school and renovate the weight room here at Menomonie High School. Okay, oops. So as we look towards this year, and if you watched the previous board meeting, I already said this, things are going really well through the month of June. Everyone's getting pretty excited for this school year, and I really felt like things would be back more to normal. And then just about the 4th of July, news of the Delta variant really began to ramp up. That's when my summer basically ended and my life turned back into COVID life. So we have a great strategic plan. We have a very ambitious strategic plan. We still are trying to make progress on our strategic plan, but it is so impacted by COVID. Hopefully, it won't be as long lasting this year in terms of trying to navigate our school system. But that's really our 2 main objectives for this year. Keep our schools open as much as possible for COVID, and then continue to work on our strategic plan. So I am going to turn it over to Leah. Leah, you can, if you want to stay there, you can look at your computer if that's easier. Do you want to do this then?
Sure.
Okay. You just hold this down on the side when you pull it down. Yep.
Okay, so we're gonna review the 21-22 budget. The budget defined is an estimate of often itemized of expected incomes and expenses for a given period of time in the future. The total budget for the 21-22 school year, we start this process early in spring. We often don't have enough information from the state to have it's a preliminary budget because the state doesn't always have all of the funding sources itemized and approved in their budget at the time we need to approve our budget. So we start early in spring, knowing that in October we will receive our certification of state aid on October 15th. We'll receive our equalized property values on October 1st. We have the third Friday pupil count in September. So those are all items that are built into our budget preliminary in the spring that we don't have the answers to until the fall. The budget includes several major funding categories. They're explained in the book, I believe, on page 7. Okay, and it's all broken down. It explains the general operations fund, Fund 27, special education, food services, Fund 50, and so on. The total budget includes hundreds and hundreds of line items. This year, the preliminary budget that we set up for 21-22 is expected to be around $56.8 million. A little bit for the Wisconsin school finance piece of it. This Wisconsin statute limits how much revenue we can raise through operational tax levy and general aids, state aid. The general state aid and school levy credits estimate is estimated to increase 3.28% in 21-22, and then 3.13 in 22-23. The increased reimbursement for eligible special education costs is set at 28.2% in 21-22. and up to 30% in 22-23. But again, those increases are based on cost projections, so it's a reimbursement of aid based on your prior year costs. And then the reimbursement for high-cost special education costs are estimated to be at around 40% in both 21-22 school year and 22-23. The state set per pupil aid amount is $742 per pupil for 21-22, and then each year thereafter, unless the state changes that allocation. The state eliminated the supplemental per pupil aid for 21-22. That supplemental aid was around $3 per pupil. And then the revenue limit per pupil adjustment, the state had set that at $0 per pupil in 21-22 and 22-23, and then each year thereafter unless they change that. The Wisconsin Parental Choice Program and Special Needs Scholarship Program.
Did not.
It's not working. It's not running on mine. Internet. Okay, so the impact, after talking, we do have one private school that participates in these programs. And the impact for the 2021 school year was 22 FTE K-8 students for a total impact of $182,600. The estimate for 21-22 for those programs, after talking to the private school, we're estimating the WPCP program that they will have approximately 45 FTE K-8 students for an impact of $378,000. And then the SNSP program is at 11 FTE students for a total of $143,847. And I say estimates because the DPI does not release their counts to us until October 15th. So there again, this is another item from the state that we don't find out about until the fall. And also the rates that we built this budget on in the spring, those were not set either. So these are the rates that we use in our preliminary budget to estimate what this impact would be. Property values for
Ryan, can you leave me on, please? And again, I apologize for these technical difficulties. Typically, we have this meeting in the tiered lecture hall, and that's how we planned everything. But then when we got word that there was going to be a large attendance tonight, we tried to accommodate everyone by moving it here. But doing that last minute change definitely impacts our technology. So I apologize for that, and I appreciate your patience. Jim, what's your question?
So the total cost of this program, to add the two numbers together, was just short of about $500,000. Is that correct?
Yep.
Yeah, much over.
It's about 521,000.
Oh, another question.
You had mentioned they eliminated some supplemental aid per student. The $742 per pupil, is that an increase in the revenue limit, or is that some categorical aid? Do we have categorical aid for students this year?
That is categorical aid, that is not on the revenue limit.
So has the revenue limit changed?
The revenue limit has been set at 0.
Okay, thank you.
Yeah.
Could you please tell us which private school that is? Is that, are you able to name that?
Sure, it's St. Paul's.
Thank you.
Any other questions before we move on?
Property values for our school district, here's a 5-year history of that. You can see for the past 4 years, it's slightly increased each year. Again, in the spring, when we prepare this budget, the Wisconsin Department of Revenue does not release these values until the fall, and so we use the same amount that had been used in the prior year. And then when we receive this information, we update it in October. Now, the state does release an early estimate here in August, and that amount is subject to change, but it's looking like we're going to see maybe a 5.1% increase in property values within the school district of Menomonie. Okay, then a breakdown of the levy. Our general fund is our general operations fund. If we look at last year compared to this year, we're expecting a slight increase of $199,805. For debt service, we're looking at a decrease of approximately $397,340, which that will go up and down based on our principal interest payments. And then community service fund, we're proposing a levy decrease of $33,000 for a total levy change of $230,535 or 0.30%. Our tax rate.
Chris, is this where you wanted to ask your question about community services?
We will have a full slide on that coming up.
Yep, and I think it'll answer most of your questions. Okay, so our tax rate history, you can see from the history, it's gone down over the past 4 years, and we're proposing that it will go down again for the upcoming school year. We're estimating the mill rate at 8.37. But that is likely to decrease even more based on the state aid certification and property values once they're released. 21-22 major budget adjustments. These are the major items that were built into this budget when we started this in the spring. Salary increases are 1.89%, health insurance increase of 3%. It includes the approved staffing plan, the revenue cap set at 0, and the ESSER 2 and 3 grants, monies that will be coming in. And I do have a slide right after this that will share what those amounts are. And then participation in Model Schools Conference and other conferences that staff have not been able to go to in the prior year because of COVID, and now possibly will be able to, we'll have to see. And then major reductions are the completion of the middle school secured entrance, completion of the weight room remodel, the end of the school safety grant, the reduction in the capital technology lease, and then a reduction in E-rate projects. Okay, so the COVID-19 budget impact.
Can you go back to the previous slide, please? Thank you. I'm curious to know what the health insurance budget adjustment of plus 3%. How does that compare to other years? And does the extra 100,000 that was spent on medical costs last year related to COVID, does that have anything to do with that plus 3% increase?
Each year we estimate what our health insurance will increase. We don't get that information again until around the August time period. So as an early estimate, we use 3%. In the last 5 years, we have not had to increase our health insurance premiums at all. We're self-funded for our health insurance, and we've had a very healthy fund balance. and have not had the need to increase it. We'll have to look and see if we'll have to increase it this year or not. The COVID increases, I was told that our plan has is smaller in comparison to other like districts in our area, so we'll have to wait and see what that actually looks like. Okay, the ESSER funds, COVID-19 budget impact. ESSER 2 and 3 grant program is a federal program as part of the Coronavirus Elementary and Secondary Emergency Relief Fund. Menomonie is scheduled to receive for ESSER 2, $1,722,327. Those funds were not utilized in the 2021 school year, and so those funds can be utilized starting for us July 1st of 21 and can be used all the way through September of 2023. And then we'll also be receiving an estimated allocation from ESSER 3 funds, which can be used through 2024. And that's estimated right now. The DPI released an estimate in early August. It's looking like we should receive around $3,868,103. And then I have a listing here of all the allowable uses that those funds can be used for. Just quickly, preparedness and response to COVID-19, learning loss, outreach and services for special populations, addressing long-term closures, education technology, mental health supports, before, after school and summer activities, and then continued staff employment.
Before we go off this slide, I just want to comment. We advocated quite rigorously to try to have the state continue funding education through the revenue limit and through the per pupil aid. And in my mind, unfortunately, the state is now, for the next 2 years, essentially expecting school districts to use all of the ESSER money to operate. And I know, Margaret, I know that you have some concerns about using grant funds or one-time funds to fund recurring expenditures, and that's a concern of mine also. I'm concerned that at the end of this next biennium, essentially there could be a fiscal cliff. Now, my understanding is that that's taken into consideration with the budgeting process in Madison. However, there's no guarantee, there's nothing locking those future dollars in. So we'll have to pay very close attention to that. We have made the decision in building this budget that we're not going to try to cut down to the levels of recurring funding. We are going to use the ESSER funding and continue with our programming and actually expand programming for some of those reasons Leah mentioned. But it is a concern that we all need to be aware of as we hit the next biennium in a couple of years. Depending on what happens in Madison, it could have a significant impact on public education across the state. Question?
As far as this funding is concerned, I see mental health supports and continued staff employment on there. Has a plan been put in place to increase further the mental health staff and the health professionals in the district that are dedicated?
So I had a hard time hearing you, but I think the question was, is some of this money going to be used to continue or increase our staffing for medical support?
Mental health support
Mental health.
and also for, building health professionals, so we don't have, nursing staff that are doing multiple buildings when there's a lot of needs.
Okay. So to answer your question, we did increase our nursing staff. We went from 1 school nurse to 2. We also have health assistants in our buildings. We are keeping that. We did not reduce that for this year. So we have that, and my hope is that we'll be able to continue keeping that. In terms of mental health support, our district has done a ton in terms of adding school counselors, in terms of adding school-based mental health services. We've talked a lot about that at the board level, and those programs are also continuing. And these funds will help fund those programs along with many other things. Any other questions? Okay. There we go.
Okay, if we take a look at our operating budget of revenues and expenses, comparing last year actual to this year budget, we're looking at a change in revenues of $1,152,626. Much of that is the ESSER funds, the COVID funds that we will be receiving. It's a 2.81% increase. Expenses, an increase of $2,635,268, or a 6.57% increase. Now, when we built this budget in the spring, we weren't sure how much of an allocation of ESSER funds we were going to receive, especially for ESSER 3. Those funds weren't released yet, and so we had projected a deficit in our preliminary budget for the 21-20 school year. And as we go through the fall, we will be updating our numbers to reflect that.
Any questions?
If we break down those revenues into categories, our largest category of revenues at 57% is state equalization and per pupil aid. The second highest is at 32%, that is our local property taxes. And then third highest is at 7% is our federal grant funds.
Do those federal grants just include the temporary ESSER, or are there other, more permanent federal grants in that?
Yep, the question was if that was just ESSER funds or if more federal funds were included in that. And yes, more federal funds are included in that. We receive title funds, we receive special education funds through the state and federal programs. So then if we break down our operating expenses, our largest expenses are at 74% are salaries and benefits, and that does include our special education staff. The second highest at 13% is purchase services and communications technology. And then third at 5% is our transportation costs. Then if we take a look at our Fund 10 fund balance history, you'll see in the past 4 years it's slightly increased. There was a bigger jump between 18-19 and 19-20. And now this year with our projected deficit, you'll see it's gone down a little bit on this graph, just as an early estimate. The portion in red is our assigned fund balance, and that's for our health insurance fund. And then the portion in blue is just unassigned fund balance for general operations. So our capital improvement fund, we call it our Fund 46. That was created, I believe it was 6 years ago now. Once we had our referendum of 2013, that allowed our school district to update all of our facilities. And we needed a plan to maintain our facilities after we've done all these projects at one time. So we created a capital improvement fund. And when that fund is initially started, you have to wait 5 years before you can spend any monies out of that fund. So it's basically a savings account for all of those maintenance project needs that we'll have in the future. So the fund balance in 2021 was $5,482,925. And then our estimated fund balance in 21-22, we're projecting it's going to go up slightly to $5,932,000. I'm sorry, $5,932,800. $854. Now, we weren't able to spend any funds out of that fund for the first 5 years, so now we're able to, we're in our 6th year. And so we're projecting a surplus in that fund, even though we are starting to spend some of those funds on projects that we need to do, whether it be technology or maintenance infrastructure needs.
Please wait for the mic.
We have a target of where we want to be in this 46. And in terms of, we don't need to keep increasing it forever. At some point in time, maybe it goes down. Where would we like to be comfortable?
Thanks for the question, Margaret. We actually have a 30-year capital maintenance plan. So we have projected out all of our roof spoilers, building envelope, pretty much everything. And we continue to update that plan every year with the school board in January. So essentially, that goes out 30 years, and then we're able to see what our funding mechanism looks like. So we are going to have to continue to contribute to this plan. But with what we've done and how we've utilized our budget, we feel that we are on track to fund all of the maintenance needs. Now, in the event that we extend our footprint, or if educational needs change where we have expenses that aren't currently anticipated in the 30-year plan, then we would need to impact our budget further. But right now, we are on track.
If there were some kind of emergency issue, then funds from Fund 46 be moved into your operating budget?
We couldn't move funds from Fund 46 into Fund 10, but what we could do is we could defer payments from Fund 10 into Fund 46 in a given year. So yes, that is an emergency mechanism we could have, and it's kind of a plan. I don't even want to call it Plan B, it'd be more like Plan F.
I just want to say too, this Fund 46 has been, actually Charlie's wife Tammy, when she was on the board, she spearheaded that along with some of the other board members, but it's been real beneficial, kind of a bright star for our district. There aren't many in the state that have a Fund 30 capital improvement plan and Fund 46 fully funded out 30 years to cover building costs. I'm very proud that our district has this in place. And the only thing I see, I think when we first did it, we had a 1.5% adjuster in it at the time. And a year like this makes you wonder what's going to happen. The nice thing is we do look at that every year, take a look at current building costs and things like that, and try to adjust it to keep it current. But a year like this will cost us down significantly.
Any other questions on capital improvement?
So our post-employment benefits is allocated in Fund 73. And in addition to SDMA funding half of our employees' state retirement, the school district also provides a local benefit in addition to that for most full-time employees. There are still some employees grandfathered in that receive a health insurance benefit. We also make contributions into a health reimbursement account, and then we provide cash stipends. The school district, as many of you know, has made difficult choices over the years to move from a more defined plan to a defined contribution plan. And in doing so, those savings from the new hires are showing to be enough to fund the benefits accrued by the retirees. And then this slide that Joe just put up is a history, so you can see what our OPEB liability was back in 2009. Our liability was actually at 28 million, just over 28 million, well, 28.9. And today, unaudited as of July 1st, 2021, that has gone down to our liability being 6.8 million, and our fund balance is at $6,429,592. At this time, we're not anticipating making any additional contribution into Fund 73 for 21-22 school year.
Any questions on OPEB? Yes.
So I have a question. So do we not need to put money in there for our, I mean, next year people are still gonna need post-retirement benefits?
I think what Leah was referring to is we do have a part of our budget for Fund 73, but the question was, is do we need to continue to put money into Fund 73?
Fund 80 tax levy will decrease by about 33,000 for the 21-22 school year, as we've had several years of a surplus, fund balance surplus in that fund, and so the preliminary estimate, we've planned for a planned deficit. The 2021 surplus was $6,904.40 this last year, which is unaudited, so that could change slightly, but that is how we ended the year.
So Chris, to your question from before, yes, the community service fund was higher in the previous budget year. And that was really primarily due to the addition of a second youth services officer. Even at that point, we didn't put the entire cost of that position in that fund because of the fund balance that we had mentioned. Now that we've had that position, and also knowing how the programming has gone in Fund 80, we're able to reduce that levy further. Does that answer your question, Chris?
Well, what it does, yes, and it's just that they didn't have listed the community officer in the total, but
And here.
Sorry, yes, except that the monetary totals that were in the previous part of the presentation were higher, and they did not have listed the community youth services officer, so there's just a discrepancy in the numbers, and then the allocation of the funds were 4 and 80. So this new slide supersedes that and makes a better explanation of what the projected revenues are, which will be less than what's on that. Okay?
Yes, in the book, that's this current year budget, so it would not include the youth services officer. Any other questions? Margaret has a question.
Okay, this, twice I brought up concern about reinstating this position through, community services when it's originally funded through transfer of service, and those dollars are still there. Joe, you know that I'm concerned about community service in general. This is about $350,000 a year on programs we are told are not essential for our students. When I was on the board, we really worked to keep user fees covering these things. And I have a concern that we're spending $350,000 a year on unnecessary programs, probably fair to the taxpayers. We talk about the mill rate a lot. Well, the equalized values of home values went up 9% this year. So the taxpayers might be seeing a decrease in the mill rate. But when you look at the 9% increase, it ends up to be about a 5.7% increase in taxes. And that's why it's important to pay attention to how we're using our Fund 80. We shouldn't be spending it like it's petty cash. If those who use these services aren't willing to pay 20% for, the taxpayer should be on the hook for the other 80%. That's my opinion. That's my opinion.
Thank you, Margaret. I will say that I think this programming is very important for many families. And I think if we raise the user fees and increase the costs of participating in whether it be community education programs or middle school athletics, I think we are going to limit the number of children and the number of families that can take advantage of these programs. I realize that not everyone in our school district uses these programs, and some people take more advantage of the community activities than others, but the people that do use them, I think, find great value in them. And it is a very small portion of our tax levy.
These are all programs that the board and everyone involved agree are not essential, and that if there was not a community service fund, we wouldn't even be offering them. We're told we would not offer these things. That's not the and I don't believe it. I don't believe that any of you believe that we don't need even one middle school activity or a well-balanced education for curricular or non-curricular. It's not true. These are essential services, not non-essential ones.
Question? Is there another question?
I think I misunderstood what she was saying. So it sounded at the end that you do consider these important services. It's not really a question, but I just want to add that 3 of the 4 on that list I have utilized. They've been essential for my family, and without those, I would have had some serious struggles. The Boys and Girls Club was the only opportunity for 3rd through 5th grade childcare, essentially, because of working times for parents that are working. Middle school activities are critical for the whole child development, and the community education offerings. This district, when I grew up here and I moved back to town, we've been having community education offerings here since I was younger, and I've utilized those my whole life. And they are, I find, critical, and if they cost more, it would be impossible for many families to utilize those things. So I don't think I was contradicting her. I just wanted to make that statement because I wasn't sure.
Any other questions? Okay, thank you.
And this is just a tax levy history for Fund 80. It shows the past 4 years. It has gone up slightly each year. And then this year, we're projecting that decrease on that tax levy.
So that pretty much wraps up the budget report. And I do want to also let you know that we do a mid-year budget hearing as well in January. And we provide a lot of up-to-date data. Once we get information from the state, once we get our enrollment count in September, I actually think the January budget information is much more helpful than the August information. But this is just the way it works. So I guess with that, Dave, we're done with the budget presentation.
Okay. Yeah, if there's no further questions on the budget, we'll move on. We have 3 resolutions, number 9, number 10, number 11, A, B, and C. We'll go through those, and after we're done with that, then it's time for new business. If anybody has anything that they'd like to address, the people here, they can do that. So resolution A is adoption of the tax levy for general debt service and community service funds. I would ask that there be a motion that there be levied upon the taxable property in the school district of the Menomonie area the sum of $17,491,612 for the operation of district schools and for discharge of long-term debt obligations for the 2021-2022 school year. Is there a motion? Penny? Is there a second? Dan? Any discussion? Abe?
Microphone. Get your steps in.
So, I would like to propose a pair of amendments to resolution A. Is that so? First of all, I must apologize, we didn't have access to the budget numbers before this meeting, so what I'm gonna say is sort of ballpark, and I apologize for that, I didn't have access to full numbers. So this annual meeting is our opportunity as voting residents of this community to meet and discuss the financial priorities of our beloved local school system. And as parents, as teachers, administrators, and residents, public health should be a financial priority. I value public health, and as a property owner and a taxpayer in this district, I am happy to pay to support public health activities in our schools. I believe the amendments I'm going to say are in order due to Wisconsin Statute 12010, paragraph 8, which allows specifically for a vote for a tax for the operation of the schools, as distinct from that or buildings or capital and so on. So here's the first of two amendments. Whereas operation of the school district requires healthy students and staff, as well as rapid notification of potential exposure to contagious diseases, the electors direct SDMA to increase the total tax levy by $200,000 from $17,491,612 to $17,691,612 for the specific operational goal of hiring 2 additional nurses to perform contact tracing and regular testing for COVID-19 in the school district. If this amount is in excess of the revenue limit, which I've just learned about has been 0, then this increase shall be obtained via the most expedient combination in your opinion, of non-recurring exceptions as in Wisconsin Statute 121.913, as well as grants provided for COVID relief. That's the first of the 2 amendments. The second.
We'll deal one at a time. So we have an amendment, motion to make an amendment on the floor. Is there a second? I have a second. Your name, please, on the second.
Rachel Henderson.
Rachel Henderson. Joe, could you address,
Well, I appreciate, first of all, the budget was published publicly as required by state statute, so the budget figures have been out there. We are subject to the revenue limits of the state. We do have ESSER funding available. Something like this, I think, would end up being more advisory. The school board is in charge of the budget, and the school board will set the budget at the end of October, and the levy for that matter. It certainly could be taken under advisement.
okay, any discussion? Margaret?
Currently, the school district has a very healthy fund balance. By policy, your goal is 25% of taxes receivable plus your fund and expenditures for the next year. So I looked.
Are you speaking to the amendment, Margaret?
Yes.
Okay, just want to make sure.
So I want to make a comment that even with spending down the fund balance by $600,000 or so this year, your goal, the target is $9 million, I'm sorry. Basically about $10 million. And when I look at this report, you're projected $11.5 million. And so in terms of that amendment, don't we have plenty in the fund balance to address this?
Yes, the expenditures mentioned in the amendment could be paid for out of the general fund, which could end up impacting the fund balance.
speak in support of the amendment. My son contracted COVID during summer school this year, and it was really a hardship for our family. We went through, we are market farmers, we lost 3 weeks of sales, we lost childcare, and we lost extracurricular and other school activities for my oldest one as well. We found out in a pretty expedient fashion, thanks very much to the school nurse at River Heights. She was incredibly helpful. We were so grateful for her attention to the matter. If we had only had to rely on County Public Health, who are doing a phenomenal job, and I'm terribly grateful for them as well, but I know that would have taken a few more days to get us that information. But the information we got expediently from the school nurse, we were able to call our friends who we had seen and say, hey, this is what happened, my son tested positive. They got tested, they found out as fast as they could. We were able to stop community spread really efficiently because we got contacted by that school nurse. And I'm worried as we go back to school this fall and we see the COVID cases rising, not having that resource is really going to hamper us as parents, as community members, as good neighbors, and being able to make right decisions.
If I could just follow up, again, this agenda item is about setting the tax levy in terms of staffing or in terms of how the tax levy is expended. That's really a duty of the school board. But I agree with you. I think contact tracing is very important, and I do think we have the staff to do contact tracing like we did last year.
Any other discussion on the amendment? Or ask? Go. Go.
So my understanding is that the discussion is actually about increasing the levy to the taxpayer, anyways, it's an increase so that that is paid for, that it's not coming out of general funds. Is that correct? Is that what
The amendment is to increase the tax levy.
Yeah.
With a bunch of stipulations with it that aren't the purview of the annual meeting. So from an advisory standpoint, this body could approve the levy with the amendment. But I don't think it would necessarily change anything in terms of the district's obligations.
So a follow-up question on that. You have stated though that the school district is going to be doing contact tracing or isn't going to do it like last year. And that's where I think I'm confused, because if you stated that the school district isn't going to be responsible for contact tracing, then with Delta, if it gets going in the schools, it's going to go further if we're not on top of this.
I agree, but that really has nothing to do with this budget, this agenda item.
Okay, I would ask Dave, would you say? Go ahead, Chris.
Whether or not the amendment is advisory or needs to be followed by the board is sort of irrelevant because it's the electors. It's within their purview at the meeting to add amendments to the resolution. So there's no problem with Dave adding this amendment. We can take it up later legally whether or not we're obligated to having to follow the amended levy. But I don't think any of us has the legal background to be able to make a judgment as to whether or not that amendment can be followed at this same time. So there is an amendment to the resolution that now we have to vote on. And conjecture as to whether or not it's valid or invalid is irrelevant at this juncture. But it is in the right of the electors to make amendments to resolutions.
Charlie, is there anything that you wanted to add as commentary?
Yeah, I don't believe that I agree with you, Chris. The powers of the annual meeting are pretty clear as to what we can and cannot vote on. Although I do agree with you that I think it is clear, and I think the advisory part of Abe's motion makes sense. It's something that we as a board should take up at a later date. I don't know that it needs to be an amendment to that resolution, though, is I guess where I'm going.
Just as a follow-up question, can you explain to me specifically where in the state statute it says that electors can't make amendments to resolutions of the meeting? I don't believe it says that.
I can say this, the powers of the annual meeting of a common or union high school district may, and then there's 19 things listed there.
Yeah.
Making an amendment to a resolution is not one of those 19 things. So, does it say that you can? No. Does it say that you can't? Specifically, no, but it's not listed as one of these 19 things.
In the, there's history, that's given at the end of the statute that shows various cases, where boards have or have not followed, resolutions that are made at, annual meetings. So maybe, you're unclear as to what specifically we can do at, a annual meeting, but for sure, it has been, put forward, legally as a case that's listed at the end of the statute.
Okay, what I will say is we have an amendment on the floor and a second. This amendment is a motion to change the tax levy. We've had discussion. This motion and the eventual vote on the tax levy is an advisory capacity from the board. So, just so everybody's clear on that. The board will actually set the actual tax levy in October, Joe. So, if anybody has discussion time left, we'll get to that. Let's go with Dan first, and then Ed.
Question, don't we approve the levy, isn't that the purpose of this meeting?
Exactly, Dan. This group approves the levy. It does not direct us to hiring or staffing or all the levy spent.
This is actually a question for Tony Schneider. You mentioned there's like 19 items under the powers of the annual meeting. Could you read item 8, please, paragraph 8?
I'm sorry, I missed the last thing you said there.
Could you please read paragraph 8 of the powers of the annual meeting?
Yes?
Aloud, please.
Sure. Tax for operations, vote a tax for the operation of the schools, all the school districts.
Any other discussion? Margaret?
I need some clarification. First of all, I don't know that there was a motion on the floor, so this is probably the motion. But I guess there was a contingency.
There was a motion and a
Okay.
second.
But there was a contingency that I didn't quite understand, at least how I interpreted it. Okay, first, amendment included increasing the levy, which we know we can't do under revenue limits. But then there was something about if that can't be done, could you repeat if that can't increase the levy? I got the impression that we could do, let's look for other means, revenues.
I'll have Ed repeat, Sam, if you could bring it back down. We'll repeat the amendment motion one more time. Exactly as you want it to be.
The full amendment was, whereas operation of the school district requires healthy students and staff, as well as rapid notification of potential exposure to contagious diseases, the electors direct SDMA to increase the total tax levy by $200,000 from X to X. For the specific operational goal of hiring 2 nurses to perform contact tracing and regular testing for COVID-19 in the district schools. If this amount is in excess of the revenue limit, then this increase shall be obtained via the most expedient combination of non-recurring exceptions in Wisconsin Statute 121-91-3 and grants provided for COVID.
Okay, we have a motion or an amendment and a second on the floor. If there's no further discussion, we will vote on the amendment. Once we vote on the amendment up or down, we'll go back to the main motion of the tax levy, just so everybody's clear on that. And this time we'll vote on the amendment. All those in favor of the amendment? As stated. Please raise your hands. Tell us to count. you ladies make sure that you know who's going to the Senate. Keep your hands up, let's do it one more time, make sure you guys have to do it. Got them? Okay, put your hands down. All those opposed to the amendment as presented, please raise your hand. Okay, hands down.
I have a question.
Okay, we have a question in the back.
I'd like to know how we can vote when we can't confirm everyone here pays taxes towards.
Is there anyone in here who is not an elector of the Menomonie district? If so, please clarify yourself. Anybody? We have a couple, 3 over here. Did any of you vote? No. Anybody else? 2 here, did you vote? No. Okay. Is that clarified?
Also, the people that spoke did not state their name and address.
Yes, I apologize. Some of them did at the beginning, but we got to continue. Okay, the votes in favor of the amendments was 64. The votes opposing the amendment was 77, so the vote fails. Okay, so we're back to the main motion of the tax levy. Any other discussion? Okay. If you could get a mic, please, again.
All right, so this is the second of the amendments that I had mentioned previously. The phrasing is the same, so, whereas operation of the school district requires healthy students and staff with minimal exposure to contagious diseases, the electors estimate, the electors estimate an increase of total tax levy by $200,000. The specific operational goal of purchasing and distributing an appropriately signed 95, KN95, or KF94, or similar masks to any student, staff, or teacher who arrives to normal school hours without their own mask during the remainder of the 2021 calendar year, etc.
Does everybody understand that? Okay, we have a motion, is there a second on the amendment? Is there a second? We have a second, please state your name. Laurel Madison. Okay. Thank you. We have an amendment to the main motion and a second. Any discussion? Joe?
I don't think we need to go through the whole thing again, but it's the same concept that, we're bound by the revenue limit, powers to do the annual meeting, or this agenda to set the tax levy. This body does not control how the tax levy is spent.
Any further discussion?
Although I love the idea of that 95 max.
Margaret?
This is just to reiterate that we do have about 2 million more in the fund balance, so that needed to meet board goals. And so some of these things that have been brought up really could be addressed by the board.
Thank you, Margaret. Any further discussion? Seeing none, we'll go ahead and vote. All those in favor of the amendment please signify by raising your hand. Okay, they got them. We'll just wait for them to write those votes down and then okay, all those opposed to the amendment as presented, please raise your hand. You got it? Question? Ellen, you want to say something? Yep, go ahead.
I'd like to clarify, I saw some children's hands up. Do you have to be 18 and older to be an elector? And if so, the hands should not be counted if they were under 18. Could someone clarify, please?
Okay, yeah, they did not count the children, just for clarification. So the no votes were, or the yes votes, the first set of vote was 54, the opposing vote was 65, so the amendment fails. Okay, that takes us back to the main motion, the tax levy. Any further discussion on that? Okay, we will, without further ado, vote on the tax levy. All those in favor, please raise your hand. If it's unanimous or high, we'll call it. If not, if you're in favor of the tax levy as presented, please raise your hand. Those opposed, same sign. Motion carries. Thank you. Resolution D, authorize annual compensation for the Board of Education members. The proposed motion that board members of the Board of Education members be compensated with annual salaries as follows: for the board president, $1,000, all other board members, $800 apiece. Is there a motion to approve? Jim? Is there a second? Alex? Any discussion? All in favor, please raise your hand. Opposed, same sign. Motion carries. Resolution C, authorize the reimbursement of travel expenses for Board of Education members. The proposed motion, the members of the Board of Education be compensated for actual and necessary expenses incurred in the performance of duties. We have a motion. Is there a motion? Penny, is there a second? Yeah. Tonya, sorry. Trying to see which one it was, the legs are burning. So motion by Danny, second by Tonya. Any discussion? Yes. Need a mic over here, please.
Please raise your hand for the mic if you want.
Can I ask for clarification on what is considered a actual necessary expense? Is there do we have a headquarters city if somebody is driving from somewhere else? to perform their duties, is that considered reimbursable expense?
Okay, the question was, what exactly are necessary and actual expenses?
That would be mileage reimbursement, possibly fees for attending a conference, registration fees, hotel fees, those kinds of things.
And just for clarification, a lot of board members don't turn anything in, some do, but that's up to the individual board member. Yes, yeah, Mike.
Hi, Rochelle, for Procedural. And my question is, what was the amount last year for that expense?
Not off the top of my head, I would have to look that up and get back to you.
The question was, how much was that budget for that amount last year? We're not sure.
What I can tell you is that our school board members, maybe attend, our school board members, again, every board member is different, but it probably averages to, maybe 2 trainings a year. That might be high. So you take the mileage and lodging and sometimes meals, but again, like Dave said, a number of board members don't even turn in receipts for that and just pay for it out of their own pockets, so it's pretty minimal.
I will also say that a number of board members will donate the salary back to the district and things of that nature too, so I don't think they're making a lot of money.
Travel expenses too for this last school year are considerably less due to COVID-19, and attendance at conferences and such are way down, so.
Any other, good questions, any other questions? Okay, all those in favor of the proposed motion, signify by raising their hands. Those opposed, same sign. Motion carries. Okay, at this point, we're on item number 12, which is other new business. I would ask if people would like to take a 5-minute break, or if you just like to plow right in it and get through stuff. What is your pleasure? If you want to take a break, raise your hand. If you want to keep going, keep going. Okay, we're going to keep going. Okay, at this time, I would invite anybody from the community that would, from the school district that would like to come to speak, raise your hands. Sam and Tony will bring you the mics, and I'll be the timekeeper. I would ask Charlie if you help keep track of the speakers thing, I'll keep track of the time. And I will stress this point, everybody, when you're speaking now, please make sure you state your name and address, please.
Hi, I'm Alex Hall. I live at 1108 Elm Ave West. You want to stand?
Please.
And today's my birthday, but anyway, I just have a question. So we've had a lot of, what has seemed like a lot, and I don't know, because I only get anecdotal report, retirements and resignations from the district this past year. It's been a national phenomenon. And so I was just wondering, and maybe this isn't the appropriate forum, but I'm just really curious about how we are in terms of staffing heading into this year. How many still unfilled teaching positions do we have at this moment? So just wanted to kind of get a pulse of what's going on with our school hiring.
Actually, Sam. Samantha Boyd is our HR director, and I applaud Sam and the building principals for their work. We are fully staffed at this point, correct?
We are, yep, we are fully staffed. We have one position that we're just finishing up with, that'll be finished up on Wednesday.
The board also approved the addition of some hourly staff tonight, so we have a little work to do there, but we're very, very pleased with the teaching staff we have. I would say that the overall numbers are slightly higher this year. I do think COVID had a little bit of impact on that. And our demographic trends in our school district, I think, really make a difference in terms of how many retirements we have. We've had some slides at our mid-year budget hearing and kind of showed we had a little bit of a peak. And I think we're through that peak now. But it definitely is tougher. It's tougher than I've ever seen it. And this is, I can't remember how many years, but like my 15th year as being a superintendent. It is more difficult now than it ever has been, and I've never seen the free agent market like it is with public education. And there's a lot of reasons for that, but it's something that I think is going to get worse. Talk to colleges and the people from South know this. The training programs, you're just not seeing the candidates come in. We do pretty well in Menomonie. I think this is a destination district for a lot of people. But especially, I was in Canop before this, and there's other small schools. I think you're going to see more and more people teaching out of certification area, and it's not a good situation for public education right now for staffing.
Okay, next.
Hi, I'm Jennifer Collins, in E531, County Road 80 in Menomonie. Actually, got several points I brought with me, but I wanted to start with when Katie Gallagher gave the weekly report on Friday, she was not able to break down adult cases from pediatrics. So I'm really confused how all of a sudden we know we have all these pediatric cases, like in a couple days' time. I'm a little confused about that. I want to remind people that we still have 3 exemptions in this state. We have religious, conscientious, and medical exemptions, and they are and can be used for any of these things. We need to know that I don't think we understand our emergency use authorization orders through the state. It is 21.USC.360BBB-3, which states that employers, governments, associations, schools, nobody can force the use of any medical products such as PCR testing, masks, or the shots approved under the EUA. What you guys, when you mandate masks and stuff and you take away a parent's choice, you're actually, again, you're not being lawful. It is against the law, and this is straight from Kyle Hughes, our constitutional lawyer. I don't currently have a kid in the district because I pulled mine out that was coming part-time. But I do want to be a voice for the parents that we don't have to ask any of y'all's permission to send our kids barefaced to school. It is our right as a parent, and I feel like we've given you guys too much power in the past. There are parents that don't take proper care of their kids, but majority of us do, and we are the parents. We are the final authority. You guys are not. So any kid that walks in this building barefaced on the first day of school, there is not a darn thing you can say or do to that child. It is unlawful for you guys to even make a comment to that child. So I would just like to remind you what your lawful rights are. Thank you.
Thank you. Hold your applause, please, hold your applause. Okay, at this time, we'll take our next speaker. Right here in front.
Does the school district have any liability for children who are get seriously ill without asking them?
Joe, that's the question.
So the question was, does the school district have liability for any children that might get ill without a mask mandate? And what I would say is there's liability in everything that we do. The legislature did approve an immunity law, which takes away a portion of that liability. That is something we track with our legal advisors considerably. And a lot of it has to do with whether or not the health department is ordering certain things or recommending certain things. But even that is pretty gray. So that's about the best answer I can give you right now, Dan.
Okay, next, I think we had right back there, and then we'll, next, you first, and then update.
Just a comment on the lady who spoke.
Name, please.
My name is Lana Laird. I live in 524th Street, Southeast Menomonie. And she was referring to the Pfizer vaccine that has got full approval now. That just came out this morning. And my concern is that, yeah, I understand you have your own choice, but the children that do not have no choice of getting vaccinated, they are being put at risk by not masking all children in those grades.
Come up front next.
So Abraham Smith, North 4433 Guarantee Street, in Menomonie, just west of Irvington. So I'd actually like to make, propose a motion on this other business item. And let me kind of preface it a little bit briefly. Although there is some discussion about liability and risk and so on, I personally think that the district rejects the advice of Dunn County Health, Wisconsin DPI, Wisconsin DHS, Department of Ed, CDC, even the WHO, everything from the county up to the global, World Health Organization. I think the district would be opening itself up to massive legal liability from parents and teachers and staff if the school doesn't follow official guidelines, even if they are guidelines and not required. If any kid, say my kid gets sick and heaven forbid does need medical care, me or I'm sure other parents would certainly sue the district, as well as perhaps individual board members, individual administrators for negligence and endangerment, failure to take care, lack of diligence, whatever you want to call it. And in any case, whether you think those cases are well founded or not, as a taxpayer, I do not want public funds to be used to defend what I think is indefensible and negligent policy. So I think what I'm about to propose is admissible in this meeting under 121 paragraph 14. The electors may direct and provide for prosecution or defense of any legal action proceeding against the school district interest. So here's the motion. Whereas the SDMA and the individual board members and administrators at this moment have chosen willfully to decline to follow health and safety guidance from Dunn County Health and the CDC, the electors direct that SDMA shall use no funds in the defense of any lawsuit brought against the district or the board members or administrators collectively or personally regarding engagement, negligent behavior, lack of due diligence, failure to take care, taking public nuisance, civil rights violations, as we mentioned previously, or other suits against any policies regarding protections against COVID-19 in the pandemic. This resolution. May I finish the resolution?
Order. 2 minutes with discussion, offering a motion.
Okay, tell you what. First of all, what statute were you referencing?
Item 14.
If you could state just the motion and no other points, please. Continue where you left off.
This resolution shall expire, allowing defense when the district adopts practices consistent with CDC and Dunn County Health Department guidelines.
Well, okay, first of all, you think it's. Okay, we have a motion. Is there a second to the motion? Jim Swanson, motion by Amy, second by Jim. Any discussion on the motion? Margaret?
Okay, I want to make sure I'm interpreting this correct. So is the motion essentially that the school district use no funds to, for lawsuits and pursuit until at some point in time, in case we start following the health department's guideline, then we wouldn't be liable? Is that?
Ann says yes. Any other discussion? Charlie?
Oh, I understand you correctly to say that if the district were sued, we could not defend ourselves if we didn't follow the health guidelines.
Dave says correct to that as well.
Correct, John, 1013 Street Southeast. I apologize for previously not stating my name. I just wanted to make sure I did hear COVID-19 in there. Some of that language without COVID-19 could leave us open to a lot of neglect occurring that is unlimited. So I wanted to make sure that that was a really clearly stated parameter there in that motion.
Well, I applaud the creativity in this motion. And I do. I think it's a terrible idea. I think you could be exposing our community to major expense. I would not recommend this at all.
I will read the motion one more time just for clarification. Whereas the SDMA and the individual board members and administrators have chosen willfully to decline to follow health and safety guidelines from the Dunn County Health Department and CDC, the electors direct that the SDMA shall use no funds in the defense of any lawsuit brought against the district or the board members or administrators collectively or personally regarding endangerment, negligent behavior, lack of due diligence, failure to take care, creating a public nuisance, or other suits against imprudent policies regarding protections against the COVID-19 pandemic. This resolution shall expire, allowing legal defense when the district adopts practices consistent with the CDC and Dunn County Health Department guidelines. Other discussion.
Then we're on 14 Avenue, 14 Avenue, 12th Avenue, particular Menomonie. I wanted to correct Dr. Zdrowski. This motion is actually protecting the community. It's you guys that are on the book for this, and of course you're going to be against it. However, I would say, if you guys really believe in the malarkey that you're spouting, I would ask that you stand behind that and support this amendment, but I'm pretty sure it's close.
I would ask that you keep your comments respectful too, as well. So, I just want this to be able. Any other?
I think my bad there. I guess I have some significant concerns with the language in the amendment. Motion, I'm sorry. And I am sitting here wearing my mask, and I am fully vaccinated. And I voted certain ways on certain things with this plan that we have right now, and I've agreed to the board norms that when the vote goes, the board supports it together until there's a new plan. Right, and I'm hopeful there is a new plan. But I'm concerned that if 5 of my colleagues choose to do a certain thing, if this motion was to pass, and I follow those norms and am part of that entire decision because it passed, then am I, as an individual board member, liable as well? I don't know, Charlie's shaking, maybe he knows more, but I think I think the point is very clearly made, and I think we have, as a board, the right and the ability and the responsibility to keep adjusting the COVID plan as a group of people. And we have to figure out a way to do that together as opposed to ultra creative movements, I guess. That's just my comment.
Thanks, Carl. Any further discussion?
Lady Marshall, 2440 Menomonie. So I think everybody in this room is probably wearing both shoes and a shirt. And in part because these are helpful, important ideas that we would need to protect the community from, I don't know, polio fungus and and also from what people might call indecent exposure. If I talk about indecent, I think it is more indecent to expose our vulnerable children to COVID-19 potentially, and to expose our taxpayers to this level of liability, no matter whether or not this thing passes, that's still a huge liability. I think it's more indecent than if I was just sitting here with no shirt on. And I really encourage the board to consider how much our current laws will restrict us for our own safety and for our own responsibleness as community members. Thank you.
Okay, we have another one. Outside, Amy?
Hi, my name is Amy Duper Sigmund, E4537473. I'd recruit myself from the vote because I'm married to administrators, so this is exactly financially, but just as a point of clarification, as an educator, because I also work in the district, it's one of the few jobs you have where your bosses, the board, are maybe not trained in your line of work at all. Of all of the jobs in the world, I think only educators and possibly those people who work for nonprofits have that. But we do have administrators that help advise the board and give them, and they're included in this motion. But if I'm incorrect, please correct me. But didn't all of our administrators recommend that we have masking in the district? Was that not part of the last meeting?
The administrative team did recommend masking, yes.
So, just in consideration of the motion on the floor, whether or not we consider it to be valid or not, but the administrative team has made their recommendations. They can't vote on the plan, only the board is responsible for that.
Thank you, Amy. Thank you, Amy. Any further discussion before we vote? Margaret?
Margaret Wright, and 68 Lane, right, I think that's, I believe I heard someone say that we couldn't defend ourselves. I don't think that's correct. The motion was, resolution was that you don't use public funds, but you could defend yourself. Is that correct? It's just that you don't use public funds, but you can defend yourself.
The motion is that the SDMA, so the school district, shall use no funds in the defense. So basically, the district cannot use funds to defend. Any further discussion?
My name is Jeff Witt, I live just west of town, E4231, 528th Avenue. My question is to everybody, when we have these the motions, whatever they are, they're kind of tagging the board a little bit, it's just a view. But my question is, from the overall group, is what makes you want to be a board member? If we're asking these type of things, asking board members to put themselves in that position, that would be my only real take on it. I think the board needs a fair chance to exercise. We all voted for them. We voted for different members within.
Thank you. Any further discussion? Seeing none, we'll vote on the proposed motion. All those in favor of the motion to basically deny legal funds to administrators and board members? You want me to read the whole thing? Does everybody understand it? Everybody understands. Okay. All those in favor of this motion, please raise your hand. Okay, you can put it down. Okay, all opposed? Okay, I'm gonna call it, it's pretty obvious. Motion fails. Okay, any further discussion under new business? Okay, if you haven't spoke, you have 2 minutes. Anybody that has not spoke, we have one back. It's hard to see that there.
Yeah, hi, Tom Pearson. I spoke during the regular board meeting. This is the first time I'm speaking during the annual meeting.
Hold it, Brian, either turn them up or have it closer to your face mask or something. We can't hear you.
Can you hear me okay?
There we go.
Tom Pearson, 803 Bittersweet Lane. And I have 3 children under the age of 12 in the school district. And I have 2 questions for the 5 board members. who voted in favor of the optional mask policy. And this circles back to the statement I made during the board meeting earlier this evening. Given that at every level of governance, federal CDC, the state Department of Health Services, DPI, local county government, school leadership, everyone is recommending, based on medical science, to require universal mask wearing in schools this year. So I would like to know, what is your medical or scientific rationale for declining the recommendations of the public health experts and consensus? Second question is regarding to the civil rights issues that I brought up in my statement. That there are 40 years of federal laws that protect the rights of students with disabilities to be able to access public education. And given the overwhelming consensus and the legal arguments taking shape in the federal education department and in federal courts regarding just the reality that masks are not considered a nuisance, they're not considered an exceptional thing to require. They're viewed as a reasonable accommodation. How do you expect to defend the school board in civil rights litigation that will take place in federal courts on this issue?
Okay, thank you. Joe?
I'll speak to the legal stuff. What I can tell you is that we are in constant communication with our legal advisors, and we will follow all the legal requirements in terms of providing services for students. I can appreciate as a parent where you think that might not be happening with the current plan. However, I do not think there's a legal argument at this point for that. At least nothing that's been decided.
Any other discussion? I'll leave it up to the individual board members if they want to answer the questions or not. Anybody?
I certainly won't. Hold on, I'm sorry, that's your first name. I am an adult and I am not gonna tell a staff member that they need to go and get vaccinated or wear a mask. I also believe it's a parent's choice. No one is in charge of my sons to get vaccinated or not, it's my family choice.
Comments? Angie? A lot of us have spent a lot of time in public discussion and meetings and things like that, talking this back and forth. And I apologize, Tom, for not answering your question the way you want. Next question over here.
My name is Ryan Martin, N68 3550th Street, Menomonie. I would just make a comment that I think that question was unfair, given that at the last board meeting, regardless of the vote, whether for or against, all board members at that point could agree to uphold the decision of the board as a whole. So I would just ask that any of the 5 board members that were asked to answer that question just respectfully decline on the fact that the board voted, the vote was adopted, and that's just a question that you don't have to answer. So as one of your constituents, I would just give you the flexibility to uphold the decision of the board as a whole and not have to answer that question at all. Thank you.
Any other discussion? Is there anybody else? Okay,
Hi, so Alex Hall, I live in Menomonie, this would be my second thing. This is just an informational item. What's really cool is that the Wisconsin Department of Health Services has made all of their data really public. So you can actually go to their website, and if you go to the bottom of the page about COVID, you can click on a link to get to county data, and you can search by county, and you can look at the number of cases that have been diagnosed per day. according to age group, and a whole bunch of other really cool stuff. So they've been really transparent about it, which I think is super awesome. So that's a resource that we all have access to.
Okay, thank you. Okay, the two people have already spoke. We're gonna go to the gal here first. Oh, I'm sorry, you're right, you're okay, yeah.
Hi, I'm Kim Leach, N2780 County Road Y, Menomonie, Wisconsin. I guess my thing here is the definition of insanity is doing the same thing over and over again, expecting different results. 4 weeks more of the mask, what's gonna look different than the last 18 months? I'm just so frustrated, it just makes my blood boil along with a lot of other people. I mean, to think that our kids should be subjected to the vaccines when the studies show that there are heart issues with the vaccines. This is a choice for parents. It's not a choice for the school district or even the public health director for Dunn County. What gives her the right to make that decision for us? And the masks do not work. The masks cause issues. My own dad had a shot in New Mexico. There's no heart attack issue in my family history, and he had a heart attack from it. He's still alive, but don't shove your vaccines down my throat. Don't shove the mask down my throat or my kids' throats. It's ridiculous.
Thank you, Kim. Okay, let's go to the Morris gal, do you still want to speak? No. Okay, we'll go here and we'll go back to Tom. We're here in the green first, and then back to Tom.
I'll just really quickly speak into, I appreciate that, Alex, for that, because I will just read off those statistics as of today. So in order for this to even continue to be a conversation, we all have to come to the truth that we have a continued problem. Well, since 11/9 of 2020, at its peak, Dunn County had 109 individuals test positive for COVID-19. That was 0.24%, quarter of a percent of Dunn County population, so a quarter of a percent. On 11/30, we had an uptick, that was 46 people. The next uptick was 32 people. The next uptick that we kept being fear-mongered into was 19. On 3/26, the next uptick was also only 19 people. The next uptick on June 23rd was 8 people. The next uptick on 8/4, we actually had an uptick of 17. As of 8/20, Friday, we have 7. As of 8/22, we have 2. That is less than 12% of the entire population of Dunn County has ever tested positive for COVID-19. So I don't understand where this variant is coming from, or where the increased risk is coming from, when according to the statistics that Dr. Alex just pointed out, we've seen a continued decline in cases per day and 7-day average since November 9th of 2020.
Thank you. At this point, we'll go back to the back.
Tom Pearson again. I just wanted to remind the board that this is a democratic process and you are elected officials. And you are accountable for the decisions that you make. And the public has a right to know your rationale and to hold you accountable for your decisions and for understanding what it is you're making decisions about. That's part of a democratic decision-making process.
Thank you. Dana? Still want to speak? No. Okay, Angie?
I would just like to speak to what you were saying, what you just said right there, because at the day that we held that vote and we all voted in the way that we did, the majority of the parents, the majority of the people that took this survey, they also wanted the same things that we voted for. So we were supporting the majority of what our voters wanted.
Okay, anybody else? Dana, you had your hand up before, no? Go ahead. If you want to speak, raise your hand up high.
I'm Tina Lee, I live at 2718 Shady Pine Lane in Menomonie. So I have 2 children in the district, both under the age of 12 and trying to get vaccinated. We already require vaccines to send children to school. We have processes where
Go ahead.
We have processes where folks with objections can register those and get out of that requirement. And masks worked last year. I watched, my children did not have a single exclusion day from Oakland Elementary last year. Thanks to Mrs. Smith and all the staff for keeping them in their masks. The masks worked. We didn't get colds, we didn't get flus. I just am very confused about why we would want to drop a policy that works last year. We kept the schools open, we kept the children who wanted to be in person, and I didn't hear any students complaining about it in any of my children's classrooms. So I understand that we want, as parents, to have choices about how we send our children to school, but we already submit them to dress codes, to all kinds of other rules. And this seems like a rule that's keeping our community safe. These rules worked last year, and I really hope we can continue to let them work so that our children can continue to be in school and learn. And if there are a few people who really cannot send their kids in masks, then there could be a process for that to be an exception. But it just seems that this is something that adults are kind of up in arms about. I didn't see children be up in arms about, and they worked, and I would like to see some.
Thank you. Next, Ray.
Hi, I'm Lisa Quinley, 1208 River Heights Road. I just wanted to comment back on Angie, what she said about the survey data. That is completely invalid data. And I would be happy as a PhD and a scientist to help create a valid survey, but you cannot use that data because it was completely invalid.
Any other discussion?
Jamie Schlosser, P. 4815 745th Avenue, Menomonie. I just wanted to get back to all the statistics that were floating around about the daily numbers of new cases. As a healthcare worker, I see new cases weekly. However, another test 2 days later turns up negative. The founder of the PCR test, Carly Mullins, has also specified that the test is not accurate. It does not exclude influenza, yet providers are not also testing for influenza at the same time that they're testing for COVID. Yet they're not taking these off the register, so they'll still count 18 even though maybe it was only 15. So the numbers are not accurate.
Okay, thank you. Other discussion? Chris?
Okay, I think it's under the purview of the meetings and pass resolutions at this stage. And I know we did that last year, so I assume we can try and do that again this year. And it would be just kind of nice if we could all agree on something. You know, and I think that everyone here is really, they're obviously good people, and we obviously care about our kids, our neighbors' kids, and whatever. But I'm worried that sometimes kids are getting lost or in an argument, especially, you know, Tom is not admittedly my friend. But when his Michaela, you know, gets lost in the argument, I think we should all be concerned about that. And that students who have IEPs that are at risk, 10 times more likely to die. Was it 4 times more likely to get severely sick? I don't think any of us, when we're having a theological battle about whether or not COVID is real or mass work, want Tom's kid to be subjected to that reality. So I propose that we make a resolution about kids with IEPs. Whereas the district is legally required to provide IEPs for approved students, and whereas these IEPs may often require safe distance and mask instruction for those children, whereas these students can have their IEPs affected by blanket masking policies by well-meaning adults, this body mandates the SNA provide safe, distance, and mask environments for students who require it in their IEPs. I think that's something we can all agree on. If our kids need special arrangements to make sure that they're safe, so their education is taken care of, we should be able to make that happen. So that's my proposed resolution.
Yeah, thank you, Chris. We have a second. Can you state your name again? Okay. Second by Rachel Henderson. Any discussion on the resolution? All right. Items.
Example, on telephone frequency studies, can I propose an amendment to add 504s and medical exemptions to that? AEPs, 504s and medical exemptions.
Chris? Chris is willing, seconder of the motion from the amendment, she is willing. We have another question back here.
Joyce Schuler, 1121 Evans Lane. I have a question about that motion. It sounds very lovely, but like when those people need, people you spoke of, when they need to eat lunch, okay? So then they need to be in a masked environment, but there's nothing in there that's going to protect, that I saw, everybody else from needing to mask, say, in the cafeteria to protect those people. In the bigger picture, it takes us back to the original problem we had of everybody having to cover themselves in a way that they have felt was harmful to themselves, to protect a few that were in need. So I think it sounds good, but I'm worried about it when push comes to shove.
Front and center.
I wanted to applaud Chris and thought I wanted to think, Tonya can verify this. If it's in the IEP, we have to provide it. And so if the IEP specifies that the person has to wear a mask, to be protected, we will have to do that. And I think our director of special education will verify that.
Thank you, Hank. Sam?
Mike Cooper, E4627, 453rd. Pardon my hearing, but are you recommending that every child has an IEP that requires a mask? Is that what you're saying? I'm not sure. Are you just saying that children who have health issues that have IEPs are the ones that require it? Okay, that's what I want to know. Thank you.
I think Sam had purposely went front to back. Okay, we'll start here first and then we'll go to the back. Go ahead.
Hi, my name is Gianna Besser, 84840 430th Avenue, Menomonie, so not force. Anyway, I had a question. I was at the school board meeting and I remember Dr. Sadowski, I remember you mentioning that you were concerned about masks because you wanted the teachers and the staff, the faculty and staff, to be protected. You said a lot of people were out last year, but they were wearing masks. So my question is, how are they not protected? Thank you.
One, I guess. Do you have, is that pertaining to the motion, the resolution, or no?
Oh, it was just a question.
Okay, I'll hopefully come back to that after we finish this motion, okay? Come back.
Aaron Basie, E7462, County Road C. I don't really see the point of the amendment or resolution because we already have it stated that it's masks are optional, so your child should be able to wear one. And also, this isn't a where you're not made to bring your child to school. So if you feel uncomfortable, it's also virtual learning.
Any other discussion? You got one back, go ahead, and then we'll come up front.
Hi, Mark Nava, M 4946 South 77th Street.
I just have a question for Chris. I mean, I don't understand any of what you're just asking. It sounds very confusing to me. So could you just say without all the wherefores and whereas and all of that stuff? Because it sounds to me like you're saying if a child has an IEP, they have to wear a mask, they have to wear a mask. But if they have an IEP, it should be written. I have a child who had an IEP all the way through school. You sit down with the teachers, the people at school, and you determine that ahead of the school year. So if it's written in the IEP that they need to wear a mask, then they can wear a mask. So I don't know what this is good for. If you're saying that if a student needs to get in an environment where everybody else has a mask, that's a lot different. So I want to understand the difference there, what is that you're asking for? Because like the lunchroom example, if you're saying that if a child has an IEP, but they need to be in an environment where everybody else has masks, then yes, everybody in the lunchroom have to have a mask if they were to go to the lunchroom. Versus what you're asking, like if they have to wear a mask because it's an IEP. If it's an IEP, then they don't wear a mask. So again, I don't understand the point of what you're asking.
That's fair. I guess I was trying to simplify and distill down Tom's problem to some kind of empathetic goal we can kind of agree on. And that is there are students that are at special risk because of the special circumstances. Is that not loud enough? There are students who are at special risk because of the special circumstances that are presented by COVID in an unmasked district. So, if those students are going to write in addition to their IEP that requires that they have a masked environment for their instruction, then the district will honor that IEP, which they're legally bound to anyway.
Okay. Joe first, and then Tanya.
I guess I would just say that this, again, is not a power and duty of the annual meeting. This body can certainly take a vote on this, an advisory vote. But it's not the purview of this meeting.
Tanya?
Last time I checked, IEPs
No,
The last time I checked, I thought IEPs stood for individual education programs. So Tony, can you help me, because maybe things have changed over the last 12 years, but when an IEP is created, it is for the holder, it's not for the environment. You're not controlling the environment, you're controlling the opportunity for success for the student, correct? So would this even be possible?
The only people who can make decisions about an IEP are the IEP team members. And so we hold an IEP team, there are members of that team, and they are the ones that write that IEP. Yes, what's in the IEP is legally bound, it's a legal document, but it's that team that writes the IEP. School boards cannot dictate what it is in or what is not in IEPs. The only people that can do that are the team, that IEP team that comes together. Each team, each student has an individual team that is separate from other students with IEPs.
This resolution does not take the board as directing any IEP. It is acknowledging that we have an obligation in order to meet those IEPs, which are now going to be changing because of the increased risk of COVID for certain students. That's all. It just seemed like something that is kind of a no-brainer. It would be good to support.
Okay, we have two more hands up. We'll start back here.
I just have a quick question for Chris on that. What would be the plan or what contingencies would be in place under that amendment or motion to accommodate children with IEPs that would suggest that they should not wear a mask due to their IEP? What do you do when those students end up in the same place at the same time?
Oh,
Or is it just one directional, Chris?
It doesn't specify, so.
So let's use, sorry, ma'am, but let's use your lunchroom example. If you have two students with conflicting IEPs, what would you suggest that the school district do in that case, Chris?
Okay, I think I'd first think about like what percentage of students we're talking about. And admittedly, the circumstance that I was talking about was a fairly limited part of the population that are incredibly vulnerable. I don't believe that this.
So one direction?
I don't, no, that's not, what I'm saying is the people that need to have a masking requirement have a successful learning experience is a fairly small population. You mentioned that Tom's child has got Downs. What's happening is that our blanket masking policies are affecting the most vulnerable among us in ways that is very disturbing. We look out for the least among us, as well as your choice, right, to wear a mask, is something that we should be able to figure out.
Chris, I'm not asking, well, I'm just clarifying my question, that I'm not discussing the right. I'm asking that the same argument applies to children who cannot wear masks due to their IEP to provide an equitable learning environment. So I'm asking, how do you make that fair and equitable for both children with IEPs, Chris?
You're talking about something that's a concept which seems to be manufactured. Now, if there's a student who necessarily has to be mask-free, we should be able to find a place in the curriculum lunchroom where they can sit.
Well, what the
Same
same
thing with
argument
a
apply
child
for the
who's
other?
a small part of the population who need a place where they can be safe and have their learning needs met. It can go both ways, but I believe that we're creating a scenario and problematics that are involved that aren't kind of touching on the most important point, is that there are the least among us who need to be looked after and shepherded through this process.
Okay,
And right now, their concerns are being left behind.
let's go to right here.
Celia Cooper, E4627 453rd, Menomonie, Wisconsin. So, for me to better understand your proposal, let's go back to the lunchroom. I have a child that has an IEP that says you must wear a mask. I have another child that doesn't have an IEP. They're both in the same school. How are you going to address the lunchroom situation for the child who requires a mask? Are all the other kids who don't need a mask going to be required to wear a mask in the lunchroom because that child has an IEP that requires a mask? Or is that child with the IEP going to have lunch served in a different area? Or are you going to address the practical application of that?
It's not the goal of the resolution to dictate how the school is going to manage that. But the goal of the resolution is to acknowledge that there are kids who have special needs, whose needs need to be looked out for. And those needs have not been discussed in public discussion, that have been mostly dictated by ideology. So as a point of fact, there are kids who are negatively affected by this mask debate whose interests haven't been considered. And what we're asking for is that at this meeting, we can come together to say, okay, we can make masking policies, but we want to make sure that there are students who are going to be adversely affected whose needs need to be taken into account.
Okay, any other discussion?
Rachel Henderson, my address is N3060 630th Street, Menomonie. And I also apologize, I still couldn't throw it up stating that. I just want to get back to the question of our actual children in the actual schools. I have two sons under 12 who attend Menomonie Public Schools. And if one of them wanted to sit with a friend who was medically vulnerable, one of them wanted to sit with Tom's daughter, they would put on their masks. Because my children understand that there are people who are at greater risk than they are. And my children understand that sometimes we do things to protect other people. My children understand that. They're 5 and 8. My children appreciate that. Another speaker made the comment earlier that in all of last year, during the school year, none of the students in any of the children's classes were the ones making a fuss about wearing masks. My kids put them on voluntarily sometimes, which I think is weird. I don't just wear a mask for fun, but they do because it's part of their costumes. They get it. They have adapted to it. Children are amazingly adaptable. They figure out what has to work under the circumstances, and children want to take care of their friends. My children want to take care of their classmates. My children know that the choices that they make for themselves impact other people, and they know that they're impacting their community.
Okay, thank you. Ken. We'll get you.
Dave, you don't know.
Okay, go ahead, Ms. Ready up that.
It's Mark again. Chris, you're wrong that I couldn't take offense to the fact that you're saying that he's manufacturing this. It's because my child would have been one that couldn't wear a mask. He would have been one that would have had in his IEP that couldn't wear a mask, okay? So to say that he's manufacturing stuff to try and, counter what you're saying, it's not true. So again, it goes back to the point of my child, I wouldn't have been able to be in the lunchroom with all of his other friends because another child had to have masks on everybody in that lunchroom. So I understand, and it's very compassionate what you're saying, and all of us want all kids to be educated. We do all care about our kids. I care about my kids, I care about your kids, whether they're wearing a mask or not, I don't care. I care about them. So to play the compassion card, I think is wrong. And I also just want to say real quick, because I'm tired of all the bullying the board is getting. We talk about bullying our kids in school all the time and how it's wrong. We never talk about legal action and not being able to defend yourself, try to bully the board into changing their minds to what they voted for. And that's just wrong.
Thank you.
Okay, we'll go to Tammy now.
Penny Gerstead, East 458 836 Avenue, Colfax. I'm a little rusty on the Robert's Rules things, but at what point can we call this vote to order or to action? Being that it feels like we're beating a dead horse right now. And
Well,
people are
this
thinking
is the calling question.
I'm calling this a question.
Is there any objection to calling the question? Question has been called, let's vote. If there's no objection, you do not have to hold the vote. And I saw no objection. Okay, all those in favor of the resolution and the second that was proposed, please raise your hand. Okay, can you put them down? Okay, all those opposed, raise your hand. Okay, put them down. Thank everyone for their patience. Okay, the motion, those for it were 51, those opposed were 76. The resolution fails. Any other discussion that would come before us at the meeting? I thank everybody here for their patience and understanding. Okay, we'll start here.
How kids who do wear masks will not be bullied. When I saw last board meeting, how the middle school student was jeered and bullied, as were the healthcare professionals, I want to know how that will not happen for our children in schools who are masked. And I'm asking the parents in this room who were jeering and booing the student last week and the health professionals, and I'd also love the board to address that policy as well, if you have some discussion on that that's going on in, among different schools. Thank you.
Thank you. I'm gonna turn this over to our superintendent as far as how it's gonna be handled in the school.
Yeah, thank you for the question. We're very concerned with that. And the administrative team has met multiple times and discussed starting the school year out with lessons on bullying, character education. I actually think most, especially the younger grades, I think it'll go easier. But I do think that's a concern, and we've already addressed it, and our teachers will be well prepared for the first day of school.
Any other discussion? Margaret, did you speak twice said on it or not on this, on the open forum, or just once? Just once, okay, Margaret? So wait to the mic, thank you.
Okay, I just wanted to make some statements, questions on the budget, but I don't want to be breaking in when we're talking about that.
No, you're free to do that, go ahead.
Okay, one of the really nice documents, they're very nice documents that can be found on the June 4th agenda. There's something I think was called budget summary. And that's the kind of document we used to go through with the public and mid-year budget hearing. And that's really the time, a good time to get clarifications on these items. The one thing that you alluded to, Joe, and you're aware of, is that I noticed that we're spending down the fund balance. Fund balance is about $2 million more than necessary. But we had a one-time opportunity not to put those voucher costs there, and it wouldn't have impacted our future revenue limits. So just in general, I have a big concern about using one-time dollars for recurring expenses. And it would help, first of all, this document is really nicely put together. It would be helpful to sort of separate out things that are one-time expenses or one-time revenues, so we can just feel comfortable that our long-term budget is healthy.
Thank you, Margaret. Joe?
No, thank you for the compliments on the report. Leah does it all, so it goes to her. But I agree. I think the way the budget is right now and the way the state is funding is very concerning. But your recommendations for that summary page, I've jotted them down. Thank you.
I want to thank everybody tonight too. Any more discussion? We're getting close to that.
My name is Casey Martin. I live in this guy, sitting here to say their address. I just want to say thank you to the board members who are facing this opposition. Thank you for standing with us and supporting the majority. We may not be the loudest, clearly, today, but we are the majority, and this meeting is a representation of that. And I just want to thank you that in the face of this intense opposition, and even what, in my humble opinion, are shameful tactics from the side that's not getting their way, that you're standing with us and you're supporting what's best for our kids. So thank you so much.
And we have one more right back.
I did kind of want to address what she said a moment ago, and she's right. There is a lot of division right now, and it's not okay. If there was jeering and booing, that wasn't okay. But I will say this, I never wore a mask into Walmart all this past year. And there was actually an incident where a lady got in my 4 children's faces and told them that they needed to get out because they weren't wearing a mask. She didn't realize I was their mother standing next to them. There's bullying on both sides. I have been told that I'm a grandma killer. My husband was followed into a bathroom at Quick Trip and the guy threatened to beat the crap out of him in there. It's real, okay? So you're right, there is bullying, but it is on both sides, and we need to it starts at home. We teach our children, you know what, this is what we've decided for our family, and everybody else's choice is theirs. And it just needs to stay at that. It's not the school's job to teach our kids to not be bullies, it's ours. And if there was, a discrepancy in behavior at the last board meeting, then, that wasn't okay. But we see bad behavior everywhere. I read the comments on the Menomonie page. It is going both ways. So let's just make a resolution tonight that we're not going to do that anymore. You guys make the decisions for your kids. We'll make the decisions for our kids, and that's final.
Yeah, Okay, we'll do Angie first and then we'll go back.
I just wanted to speak to the mask bullying also because they did recently hold, like group things and my daughter was a leader of one of those. And she said that there were a few kids at the high school that were wearing a mask. And so I specifically said, well, how did that go? Did anybody make fun of them? Was there any bullying? And she said, no, absolutely not. And she didn't see any that day. And I mean, that was just a small part of the high school population, but I definitely think that that is more the norm than assuming that everyone's going to be bullied. And I also think that, you know, handling, we have disciplinary procedures in place for bullying, and so the kids know that, they know that there's consequences for that, and, you know, we as parents should stand up to that, and the teachers too, and so I think you're more focused on something that I don't think is going to be as big of an issue as you think it's going to be.
Okay, I think we have one more here.
I'm Betty Burden, 637 Grandview Court, Menomonie, Wisconsin. A grandparent, have a lot of grandchildren in the district, and yes, I stood up for, masking. I want to thank you that you're having it here in the auditorium. I think some of the situations that happened at the school board, because I was there, I did not see the same perspective that she did. I just thought it was an unusual situation because of the situation. I mean, we had hardly a room. I had really bad knees and I had to stand the whole time. I thought it was kind of disrespectful to the people. But I do want to thank school board members. I know my dad was superintendent of schools once, and it's very difficult to be on a school board, and I know that. And it's really hard, this whole situation, because it divides people. We want to be a united community and to stand for our children. And yes, it's a hard decision, and that's why I felt if you can have courage to take on your stand, then I can take a stand and say this in public. Thank you for what you're doing.
Thank you. I will say, just as a brief comment on the board meeting, you never know how many people, Joe, are going to come to a board meeting, and obviously that one, we didn't have enough room for everybody, so apologies for that. It's hard to predict. This year was a good setting for the crowd we have tonight, so we're trying to move through it. Way back.
Hi, Elson Feller, E5306, 470th Avenue. I have a child who's in the district, and I guess I just have a question more about the contact tracing aspect. As far as that goes, my understanding is that it's moving all to the public health department, not so much being in the schools, is that correct?
We covered that a little bit earlier. It's probably gonna actually look pretty similar to last year. Our public health director has ordered us essentially to do line lists if there's a case in school. So if there is a case, our school nurses will be figuring out who that student was near, and they'll be turning that over to the health department.
And then the health department, so the district itself will not be making the calls, correct? It'll all go through the health department as far as contacting those individuals on that line list?
At this point, that's correct.
Okay.
But the health department will also notify us, and then we will be excluding those students from school.
Okay. I guess I just have a concern as far as the amount of overload on that system, because how many different schools will report to the health department? And so it's Menomonie School District and?
Colfax and Boyceville and Elk Mountain.
Okay. So do we know how many contact tracers they have at their location?
Katie Gallagher indicated that she is hiring more. I don't know what the exact number is.
Okay, so I guess my concern is, I personally, in my place of business, I have had to call families to contact one classroom of children. It's taken me almost till 9 o'clock in the evening to contact one classroom of children. So I just worry about the turnaround time on that for our children, and this is all children, whether you choose masking or not. When you don't have masking in the schools, when I'm looking at your flow charts, it's showing that that those children will be considered in quarantine contact, correct? So if you're not masked and you're within the 3 feet, 15 minutes more?
Correct.
Okay, so I guess I'm just putting out there that concern about being able to contact that many families in a timely manner to be able to isolate, to be able to quarantine, to be able to make those contacts. So if there is an uptick, whether there's masking or not, how does that look?
Yeah, I'm very concerned with that. I think there's gonna be a ton of exclusions. I think the notifications will be late. And I think it's gonna cause many more problems in our schools compared to even last year.
And if we're really looking at students and their experience in the classroom and their education and what's happening for these children, and you don't have that quick virtual option for them to then go quickly online or to know who's impacted, or if it's even impacting, you know, if we still have more breakthrough with vaccination people. I think that's the piece that I think about and look at, and it's not easy to contact tracing. You can't leave a message, you have to say for them to call you back, you can't say why you're calling. You have to just give the information, leave your number, and wait for it to come back. And so it takes a long time to contact 12 people on the list or 15 people on the list. Now you're looking at 3 different school districts, all going to the health department. This could be a hot mess.
Any other discussion? Okay, we're on to, we're almost at 4, well, so 3 hours for the annual meeting, almost 4 for the total. Yeah. I just want to say a huge thank you for myself and the rest of the board for the respectful nature of everybody tonight, how they carried the out. I know we don't all agree on things, but hopefully we look forward to head and do well. At this point, I'll ask for a motion to adjourn. Penny, is there a second? Randy Martin, second. All in favor, signify by saying aye. Aye. Opposed? And the meeting is adjourned. Thank you, everybody. We'll take a 5 to 10 minute break, and then we'll reconvene, the school board will reconvene for closed session.
If you don't know, now know.